I seek agreement that agenda items 4, 5 and 6 recorded by Hansard. Agreed.
Agreed.
Apologies, Caleb Boyle, and other apologies. No. Draft minutes, pages 5 to 9. Members content their accurate record.
Agreed.
Fair members, summary table of requests for information, pages 11 to 13 for information. Moving on to the first briefing then, preparation sheet, page 3 of the table of papers. Also refer you to the Audit Office report, pages 15 to 94 of your packs.
Oh, you don't do things by us. It wasn't bad. When we had it,
Okay, members, welcome to the committee, Patricia Corbett, the Director of Human Resources and DHSSPS, Marie Mallon, the Deputy Chief Executive and Director of Human Resources in Belfast Health and Social Care Trust, and Mr Tom Hamilton, the Deputy Director of Personnel and Corporate Services within the department. So you're all very welcome this morning. Do you perhaps want to give us a wee update on where we are in terms of the report, the findings and how the department has acted on them?
Certainly. I'm glad to do that. Thanks. Thank you for this opportunity to provide some oral evidence on the audit report into sickness absence in the wider health sector. You've just introduced my colleagues here, and I'd just like to say that Marie is here today. She is the HR Director for Belfast Health and Social Care Trust, which is here today to represent directors from all across the trusts in the HSC, and Tom with a specific role in representing the department in relation to any aspect of the department's sickness absence. My role within the department is Director for the HSC with responsibility for HR pay and policy. So the primary reasons for sickness absence in the HSC are not unexpected, and these are due to physical and emotional demands of the job. All of the trusts continue to very proactively address, manage and attempt to reduce sickness absence. Measures are being undertaken which include rapid referral to physiotherapy, staff counselling, health fairs to promote positive health and well-being, training of managers in the management of stress and how to get the best out of our occupational health service. And as you know from the information provided by the audit report, within the trust there are two main causes of sickness absence: musculoskeletal problems and mental health issues. Both of these are increasing, and trusts are giving particular priority to addressing these causes. There's also a significant level of sickness absence for which the cause of illness is unknown, and trusts have highlighted that typically this may relate to short-term absence of 1 to 3 days, where under absence protocols individuals are not required to self-certify or produce medical certification. That's just a general update. What I'd like to do is turn also to each of the recommendations within the report, give you a flavour of the position where we're at the moment. In relation to recommendation 1, clearly we all agree that the information systems for measuring sickness absence must be fit for purpose and the data required for analysis and reporting robust. The implementation of the new HRPTS system across all of the trusts provides this facility, and it will enable the department to gather data, review sickness absence and inform the development of future policies or interventions with the trusts. As part of the department's governance arrangements with trusts, each trust is required to establish a realistic sickness absence target, and this is expressed as a percentage of available staff days to be achieved. The department intends to examine the target set in 13-14, which was 5% of available working days lost, and use these to inform the baseline for 14-15. This was as directed in the NIAO report. In relation to recommendation 2, which was about addressing the long-term sickness absence caused by mental health issues and musculoskeletal illness, and looking at monitoring, the primary reasons for this sick absence in the health and social care sector are not unexpected. This is due to the physical and emotional demands of the job. There are varying levels of sick absences between staff groups. This is also not unexpected. For example, it is not appropriate to compare sickness absence and administrative grades with those of nursing absence levels, or to compare indeed the Northern Ireland Civil Service with the health and social care sector in terms of sick absence. Factors such as the infectious contact with infectious patients, the nature and the intensity of the work would need to be taken into account in any such comparison. All trusts continue to very proactively address, manage and attempt to reduce sickness absence. Examples of measures being undertaken include rapid referral to physiotherapy and staff counselling, rolling out of health fairs to promote positive health and well-being, and providing training to managers on the management of stress and how to get the best from the Occupational Health Service. At a recent workshop we had with trade union colleagues, and I say we, it was HR directors in each of the trusts and the department, we agreed to work more closely and collaboratively in finding ways to support staff and to improve attendance. In relation to the final recommendation, which was mostly about monitoring, the new HRPTS system will provide an excellent opportunity to review the area of sickness absence. Once the new system is fully established, the department will work with trusts to set appropriate targets and establish a robust and consistent baseline. The reports from the system are still being tested, and once our departmental statisticians are content that these reports are fit for purpose, we will commence regular monitoring. This will be a great improvement as the current information is compiled from manual returns. The new reports will be used to give us early warning of issues of concern and indeed to highlight areas where there is best practice. A key opportunity from the new system will be the improvement of sickness absence from making information available to frontline managers in real time. In addition, regional sick absence reports by variables such as the reason for absence or by particular group will provide greater granularity and scope for analysis and indeed early intervention. Over time, these reports will provide the trust organisations and the department with a much more comprehensive and robust picture of sick absence across the region. And just turning to the department and sickness absence in DHSSPS, absence levels within the department have reduced significantly over the last number of years. Although the 2012-13 target of 8.2 days was not met, the department's absence level was significantly below the NICS average of 10.6 days. The target for 13-14 is 7.5 days. The main reason for absence due to illness are in line with the NICS overall, with anxiety, stress, depression, other psychiatric illnesses being the main issue, followed by musculoskeletal problems. The department has a very successful workplace health improvement programme aimed at encouraging and supporting staff on health management techniques. And in the department, we also have an improvement plan which includes regular briefings to the board to raise awareness, early referral of cases to occupational health, measures to improve recording of absence and complete return to work interviews, and additional support for managers where there are particular complex issues and cases.
Thank you. Okay, we're just going to go straight into questions. Peter?
Yes, thank you, Patricia. Just to go over one of the statistics there again, just trying to pick up. Did you give figures there for the department for 2012-13?
2012, no, I gave 13-14. Sorry, the 12-13 target of 8.2 days was not met.
Right. I'm just wondering in relation to that, because obviously from the audit reports we have, which on the face of it if you give the a bit of a clean bill of health for the Department of Health, because the figures were pretty good. They had produced figures, for instance, for 11-12, showing that the absence level had gone down to 7.1. And now, to be fair, I think in terms of, for instance, 11-12, of all the departments, the health department had the best figures. But there seems then to have been a little bit of regression in terms of if you've gone up to 8.2 this time round. So I'm just wondering what you see as maybe the factors which led to maybe a little bit of slipping back. And in terms of the targets, I mean, do you think you've produced targets that are challenging enough in that regard?
Yeah, I mean, if I could maybe pick that one up. Unfortunately, yes, over the last couple of years, the figures have gone down, although the trend over the longer period is a downward trend from 11.4. Month on month, we would have on average between 8 and about 12 or 13 people off sick. Unfortunately, for the last couple of years, we've had quite a significant increase of people suffering long-term conditions such as cancer and heart diseases. We have, I suppose, almost just under 50% of the staff in the department. I think we have 638 staff in the department. Just under half of those would be over the age of 50. So there's a tendency for people not to go off sick as frequently as perhaps in other departments, but when they do go off, it tends to be for the more serious type of conditions. And as I say, over the last year or two, we have seen a significant increase in those more serious conditions. We do have robust procedures in place. We have actually tried to tighten those up in terms of referrals to OHS. During the year where we did have the good figures in terms of 7.1, we were referring, as probably most NICS departments, at about 20 days to OHS. We've reduced that down to 15 days, trying to get people to OHS at a quicker period. We do have referrals after they've been seen by OHS to try to get to the nub of if there's issues that we can get them back, make any adjustments in the workplace to get them back to work at the quickest period or the quickest time. But unfortunately, we have seen that increase in those serious conditions.
And in terms of, obviously, because there's the issue of directly the department and there's the issue of the trusts, and I appreciate what's been said in terms of, you know, with the trust, you're not necessarily always going to be comparing like with like, because there will at least be, albeit it may not be an enormous factor on it, but you know, you mentioned, for example, factors such as the fact that a certain number of the staff on the front line within the trust are in direct contact with patients. There is always the danger that because of the nature of things, they're more likely to pick up infections, even sort of colds or flus that are going around in that regard. You mentioned, obviously, in terms of the work with the HR managers coming together to try, I mean, is that how you see basically trying to apply best practice? Because obviously it's very useful if you've got a lot of good procedures within the department, but if those aren't rolled out into the trusts, then there's going to be a limited amount of value, because that's obviously where the bulk of the staff will be in that regard. I'm just wondering then, how are you ensuring then that whatever good practice and lessons that you've learned directly within the department are then applied across the full system? Because obviously one of the things about health is, as I said, the department itself is arguably almost just the tip of the iceberg. There's an awful lot of organisations that are directly connected up, either to the trusts or indeed other organisations that are connected up with the Department of Health. And how are you ensuring therefore that that is rolled out across the full spectrum of health?
Well, you're absolutely right. I mean, that's part of my role as well within the Department of Health, to work and understand what's happening across the NICS and to take that best practice and lessons learned into a forum where I meet with the HR directors across the trust every month. Excuse me. And as part of the, sorry, I should add that each trust has its own policy, albeit part of a regional framework for tackling sick absence. But indeed, there are very many innovative approaches being adopted within the trusts. And some of these are similar to what's happening in the NICS, but indeed there are different and additional measures and activities that are taking place, and each trust has its own plan for addressing those. So yes, it's a two-way communication in terms of sharing best practice.
Yeah, happy to comment. I think taking the point about the issue of infection, it's not only about our staff picking up infection from patients, but we're very sensitive to the fact that we would not want our staff to endanger the lives of patients. So, you know, if there's one thing about someone coming in with a sore throat, which I apologise, I have if my voice goes today, into an office environment, and I will keep away from you. But there's another thing when you're sending a nurse.
I'm sitting beside Paul Gervin. That's 10 times worse. You'd certainly not be standing near any ward in Northern Ireland.
I've not appeared because I was sick. It would have been too ironic. But yes, about sending a nurse in to a vulnerable patient. So we're very, very conscious of that. And that does factor in, and if you like, we accept that. I mean, I'm happy to give an overview of the approach we take in trust generally, if that would be helpful.
Mm-hmm. Yeah, I think that would be, yes.
Okay. I mean, I think health, I would say at the outset, it can't be compared with other government's departments, but it can rightly be compared with other health systems, England, Scotland and Wales and so on. And of course, we do that. And if you like, the industry norm, as it's described in HR circles, would be in around 5% on average, which of course means some organisations will do better than others. I think in Northern Ireland and indeed throughout the UK, all trusts are conscious that it's not just about meeting targets that are set, which are absolutely the right thing to do, but also because sickness has a cost. It has a cost in terms of financial costs, which is hugely important. It also has a cost in terms of patient continuity and care. If sickness levels are too high and you're dependent on temporary staff or bank staff or agency, that's not the best way to treat patients. So we push very hard in relation to sickness levels. And I think in health we are well placed because of the nature of our business to understand that if we try to be proactive in terms of securing our own staff's health and getting them to take responsibility for their health and well-being, that also has an effect generally in the population, which is a good thing. So our approach, if you like, is threefold. One is the preventative measures that we would undertake. Patricia has rightly said that the two main reasons for sickness absence in health right across Northern Ireland are musculoskeletal and mental health, with mental health being the highest. And that consists of a big part of it's bereavement, a big part of it could be depression associated with personal lives, and people go through these things in life, and we know the statistics in relation to depression. Some of it will be stress associated with workplace or other situations, marital or otherwise. And it's interesting to note that that's reflective of society, and that's the same as the civil service. But it's hugely important. And the other one is musculoskeletal. So what do? Knowing as we do that consists of 40% of our long-term absence, we put in place strategies to address that. And those strategies in relation to mental health are very, very extensive. It's about looking at risk assessment individually and collectively with individuals. And it's about managers being able to spot the signs of stress. And we have training that we give to managers to say, look out for these signs of stress with your staff. We've booklets, we've information. Here's what to do, here's how to address it, here's how to have the conversations. And if there's a limit to what you can do, then we ensure that they refer to our occupational health, our staff counselling service, or whatever is appropriate to their needs. And that's hugely important. And in a collective way, we need to know, because health is very pressurised, health and social care. And I should emphasise social care, because many of our social services staff, nursing staff, etc., have to deal with very challenging behaviour from our more vulnerable clients and so on. And that can cause pressures, as well as the pressures you hear in ED departments and wards and so on. So we have to take account of that and try and be proactive, and we do that. And we do this risk assessment, and we've worked very closely with Health and Safety Agency to understand what that means and how we can bring about improvements in certain areas. And then when it comes to the situation where people need that referral, then we try and intervene and assist. Musculoskeletal, again, preventative and then addressing it. The preventative, and you think about, across Northern Ireland, there's a huge amount of nurses. There must be over 20,000 nurses who are dealing with patients every day, lifting and handling. And so we have lifting and handling as part of our mandatory training to ensure that they can do that safely. But things happen, and we make sure we have the right equipment and so on. And then if things do happen, or indeed if they have musculoskeletal issues arising out of their own health, a number of schemes within health across the patch whereby they get pretty rapid access to physiotherapy. And we make sure that, if you like, that our patients are not disadvantaged by that. We have ring-fenced and got some money to try and put in physiotherapists to look at our staff specifically to accelerate their return to work. We also then use things like phased return to work, where people can take it easy, maybe not go into their normal job. We get them back into work, because work, and there was a TUC report there talking about work is good for you, and we know it's good for the mental health. So those sorts of approaches are taken. In terms of health and well-being generally, we have many initiatives right across the Trust, and I could pose some examples. We have about health and well-being, because more than health, things like choirs, Zumba dancing, Weight Watchers, looking after yourself, mental health issues and way to look after yourself, sexual health, men's health, health preventative measures, health improvement measures, all to try and ensure that our staff are in the best place that they can with regard to their health before they come to work. Having said all of that, it is still a challenge. It's a challenge to move it, that other 0.5%. And while I've seen a downward trend from the formation of the trust since RPA and 2007, and the trend has been downward, it is sitting and it's plateauing at around 5.5 across the patch on average. Now, what I'm delighted to say is that, and in line with the recommendations, we have implemented a new system, Human Resources Payroll Subsistence System, which will measure sickness levels more accurately, which will give us more detail in relation to the types of sickness, the category of sickness, and will give managers real-time information as opposed to retrospective information when sometimes it's a little bit late, so that they can apply the third part of our plank, which is our absence protocol, whereby managers are obliged, and it's a jointly agreed absence protocol with trade unions, are obliged to follow an approach including triggers, which trigger a certain amount of absence, which trigger a certain amount of action, return to work interviews, counselling, disciplinaries, referrals to occupational health, all of the things that should happen so that there's not a passive approach. And then ultimately there's an accountability for that from the point of view of holding managers to account. So I think that, sorry if I've gone on a bit on that, but it's a potted version of our approach.
Maybe, Chair, just ask one final question just arose out of that. It's interesting, I suppose, listening to what you said in terms of the very thoughtful approach that's been developed in relation to this. Now, I appreciate that if you look at other branches of the public service or the civil service, that some problems which are particularly acute for yourselves. So if you talk about the musculoskeletal illness, for example, and you're saying, for example, looking after the situation in which nurses or porters or whatever are, for example, helping to lift patients on a regular basis, that will have a particular impact, which, for example, if you're sitting in a rates office and the lifting you're doing is actually lifting a rates bill, it's not going to be quite the same strain. But the thought occurred to me that you're coming at this from, I suppose, two particular situations. One is the general thing of dealing with the various medical problems, be it sort of mental or physical, of your staff, and dealing with it in that broader sense as an employer. But you're also, in terms of adopting strategies, perhaps in a unique position within the civil service and the public service, which is that because you're the Department of Health, there are a range of those ideas, a range of those things which are particularly acute to yourselves in terms of potentially providing solutions, looking at physiotherapy, having, if you like, a degree of expertise, of input in terms of medical thinking on how best, for instance, to get people back to work, etc., etc. Now, you mentioned earlier in relation, I think Patricia mentioned earlier, about particularly with the trying to ensure that there's a rollout from the department through the trust, through HR. I just wondered, to a certain extent, I would think that with a lot of that stuff, you're potentially in a position within the public service in Northern Ireland, in a lot of areas perhaps closest to best practice of any of the departments, because you've got actually on hand a certain level of expertise which isn't necessarily going to be there in the other departments. I mean, to what extent is there interaction between the departments to try and share that degree of best practice? Because it does strike me that if, generally speaking, you've been more successful in reducing, for instance, the number of sickness days, there's something to maybe peculiar to yourselves, there are also a lot of lessons potentially kind of across the civil service, and I'm just wondering to what extent you're sharing that best practice, or is that being sought to try and ensure then that what permeates in yourselves will permeate in the Department of Justice or Education or whatever?
Yeah. I mean, if I can maybe answer that, there are various forums, and certainly it is discussed, and I know I think Colin Lewis is coming in a few weeks' time to talk about generally the NICS and what's happening within different departments, and certainly Colin and his team would liaise frequently with ourselves in looking at programmes that we have in place. I know Ken Adley was here last week and talked about the WELL programme. We have our workplace health improvement programme, which fits in with what Ken's doing, but we very much link in with the like of the chief medical officer and his report, and those issues which are being flagged up, the sort of the mental health issues, the obesity issues, and we try to have our own programme in the department which seeks to address those issues through a range of programmes in terms of healthy eating, fitness, weight loss, programmes about depression, mental illness. As I said before, we have a fairly high percentage of staff over 50 in the department, so we look at what we can do in terms of providing help for staff who have caring responsibilities for, in many cases, elderly relatives, as opposed to some other departments, a bit like of SSA, who would have more child caring responsibilities. So we tend to try to tailor what we can offer by way of support to our staff, and there is opportunities through DFP and through CHR corporate services to share that information so that we can hopefully get best practice across the NICS.
Okay, thank you, Chair.
Okay, Leslie, I'm going to bring you in at this point because we've sort of delved into...
Yes, indeed. You were getting very close to the subjects very dear to my heart, and that's the one of mental illness and the musculoskeletal, is it? Illnesses. You did touch there on what's been sort of happening there, but obviously it's not enough because the incidence is increasing. What further plans have you, if any, to address this particular concern?
Well, I think I mentioned about health and wellbeing. We have a health and wellbeing group that consists of professionals from within the trust, as well as HR, occupational health and so on. And we set down a plan every year as to how we're going to address those two major causes. And we work very closely with bodies outside of the trust, including health and safety, people that deal with mindfulness, which has become one of the new issues. It's about cognitive therapy and how you perceive what's happening to you in life and how you react to it. So all of the time bringing in best practice, and as was mentioned before, it's probably easier for us to do it because we can access it, best practice into the implementation of our stress strategy and how we roll that out. So anything that is known to help is something that we import. And one of the big things we have found about mental health, I mean, people will have lots of issues, private issues, etc. Things like being together in a group and things like exercise really, really help. And that's why we have the exercise classes, the Zumba dancing, the choir, not medical interventions as such, but to deal with people as a person and to engage them with other people, because we have found that that's one of the best ways so that they're not isolated with their problem. And our experts would tell us that that mindfulness is really helped by that approach. So we're informed by the experts in terms of the strategy we employ.
So that's something that's new, is it, you're just telling us here?
Well, it's certainly, and I can speak for my own trust, over the last couple of years, that whole Here For You, we call it, Here For You, it's a whole approach to outline how we can improve people's mental and physical welfare. And people can tap into that on their own, just by saying, I want to join, or we can refer them if they've already gone through staff's counselling or occupational health. So it's that idea of, I suppose, engaging people in a positive way so that they are as far removed from their problems. That's not to say that they won't have problems. And one of the practical things that I would say, for example, is a lot of individuals, particularly during recent years, have had financial problems which have had a big bearing on their mindset. And some of the trusts offer help and assistance in relation to, for example, I could talk about my own citizens' advice so that people can go and get confidential counselling about their own personal problems. So it's a more holistic approach. It's not just saying we will deal with the symptoms of your problem, but it's also we will try and assist you with your problem.
Yeah, but I accept all of that, but is this a new idea or is this something you've been doing for a long time?
Well, I think all those, certainly citizen advice we've been doing for a long time. The Here For You programme is just the last couple of years in its totality. There's been different interventions over the years, but this is a very intense version of it. And we also do things like health fairs. If you would go into a canteen area or whatever of a day, you would find some of our occupational health and other people checking people's cholesterol, their blood pressure, all of that. So the totality of the number of things we're doing, I think, is the most recent. We've always done some, but bringing it together in one major programme, I think, is the difference.
All that activity doesn't bring further stress with it, you think? Could I just ask you one other quickie? There is, in the tables in the report, the breakdown between the, looking at page 62 here, between the mental health issues, the musculoskeletal ones, and also the unknown ones. Can you maybe fill us in a little bit more, because that's quite a significant proportion?
I haven't found it, but you're absolutely right. The unknown one is one of those codes you never want in anything. It's kind of like a dump code, and it tells you nothing. And what we're happy to say is, with the new HRPTS system that all trusts have just implemented in the last few months, it doesn't allow anyone to enter anything unless they're explicit about the condition. For example, if they go into it and they're asked about the condition and they say post-surgery recovery, then it will force them to go into a category as to the type of surgery. So they can't complete, i.e. the manager cannot fill in that field on the computer unless they give exact information. So in that way, in the future, we will have more precise information other than other, because it's not helpful.
And if I could add to that, the other element of that system is that we'll use what are known as the SART codes, the sickness absence recording tool that is recommended by the medical professions, and that's what's used in the NICS as well. So you're using the same recording tool, which is European and used, and it can be compared not just with public sector, but in time would be able to compare with, say, other trusts or other similar health bodies as well.
Thank you.
Can I just ask as well, I mean, obviously, Leslie's touched upon some key points in terms of mental illness, the musculoskeletal illness. You talked about healthy eating as well. Obviously, that's a big issue, and a lot of the times you go into a hospital and you get a plate of chips for when you're taking a break from seeing the patient. Do you believe the Department of Health at our hospitals and places within the trust or within the department remit where you receive food, where you eat, do you believe that is exemplary in comparison with other jurisdictions and even in terms of European standards?
Well, I think our Chief Medical Officer was mentioned, and it was only last week I heard Dr McBride on the radio once again emphasising the issues around obesity and healthy eating. So we, in the Department of Health in the Trust, are very aware of what he's saying and his requirements. In our canteens, and you're quite right, you will go in and you will see chips, but you will also see healthy options. And there is that issue about giving people choice. And it's a debate, you know, do you exclude the chips in favour? I mean, the first thing you see when you go into where I'm situated in the city is the salad bar with all of the healthy options. And then you will go to the hot plate, and inevitably there will be chips as well as other hot food. And it is about choice, but on balance, if you look throughout the canteen, the majority of the food is of a healthy nature. But it is about giving people choice.
Mm-hmm. But is that any better than any other workplace? Because the Department of Health, I think, should be leading in terms of healthy eating.
Yes, it's a fair point. Whether it's better than other workplaces, I'm not sure, because I don't know about other workplaces. I haven't done the benchmarking, but I take your point.
Yeah,
yes.
Because I think it's important, if they are going to deal with sickness absence, then you do need to look at the public health aspect, active travel, healthy eating, and all the rest of it. I mean, if I was to go into a filling station and I'm queuing to pay for my diesel, all I will see will be a row of chocolate and crisps.
Very healthy.
And if I'm going into a hospital and I'm not seeing a healthy option when I'm queuing for food, then the whole way that place is laid out is wrong.
Yes.
So there are ways and means that you can highlight certain choices to people within the hospital jurisdiction, and I think health needs to make that a priority if it is to be seen as a department for health.
Yeah, I mean, we do try and do that, hence the reason why the salad bar is the first thing that you see. But yes, and I mean, I'll reflect that back generally to the Trust, happy to do that.
What is the department doing then in terms of active transport as well? I mean, it's something the Institute of Public Health raised with us was two of the main issues was healthy eating choices and active transport. Is the Department of Health offering enough choice and accommodation for staff in that regard?
Well, I was just going to say the Cycle to Work scheme, yes, organisations are signed up to that to encourage people to cycle to work, obviously because it's a healthy thing to do, and also because of our environmental aspects, you know, that we try and we encourage. And there's a big take-up of that, and you will see regularly, if you come into any of the hospitals, lots of folk, including lots of our doctors, interestingly enough, who cycle to work, and we try and provide somewhere for them to chain their bikes and so on. So we do encourage that, very much so, yeah.
How do you encourage it?
We encourage it through staff bulletins, through the hub, the intranets in the organisations, you know, sending out flyers saying this is part of what you can access. It's part of Here For You strategy in Belfast. There'd be a different name in another trust that people can access. Here are the things that you can access to make your life better. And I mean, it's everything from cycle to work. It's everything from all of the health issues and things that they can access. It's also issues around work-life balance and family-friendly policies. There is a whole cohort of policies which overall we include within our trust, and it'll have different names elsewhere, which are about improving working lives. Okay? Our approach to improving working lives, improving your health, improving your balance, improving your availability for work through ensuring that there's care policies, etc. So it's within a strategy within a strategy. But there is a good take-up of it. Yeah.
Okay.
It's just on the mental health
Just a quick
issue.
one. I'll bring it.
It's on
Quick one? Okay.
on the mental health issue, and it's really from a management point of view, and I really do believe that this is something which does need to be looked at. We have identified through another committee that a number of us sit on, where there is those who actually either put themselves forward as whistleblowers or whatever, and because of a culture which exists within, specifically, the Department of Health, of bullying, and it's evident, there is a reluctance for people to do it, and as a consequence of that, a number of people who do go forward end up taking off time on stress-related sickness. And I can think of one area where one gentleman, and it's in the private sector, where they identified that in one area they were having a lot of people off sick for stress-related illnesses, and the management decided that they would look into it, and they decided to change one person. They got rid of him, and it halved their sickness benefit, or their sickness in that area, in that one department. It halved it directly overnight. And I'm just saying, has there ever been a culture or an investigation into management and areas where there have been maybe big areas where people are off with stress, and individuals maybe are the cause of that?
Well, in a system with 70,000 staff across health and social care.
Well, I'm talking about one where there was 1,000,
Yes.
1,500, well, almost 1,500 people working in that place,
Yeah.
and they were able to deal with it, and they dealt with it.
No, I would agree with you. And there will be instances of bullying, and certainly in my career in the health service, I've dealt with many instances of bullying. In terms, and you're absolutely right, the impact it can have on a department and so many people. So it has to be addressed. So let me be very clear about this. Bullying is not tolerated or accepted within health and social care. Where it happens, it has to be addressed, and it has been addressed.
But it's usually coming right from the top, and by that I mean from consultants down.
Well, I've dealt with consultants in my time who bullied,
Yeah.
And you're absolutely right. It doesn't matter whether it's a consultant, whether it's a clerical officer, whoever, it's not acceptable, and we make that very clear. And that's why we survey our staff to try and find out what's going on. If they make complaints, and remember all our bullying policies and our approaches to bullying, harassment, whatever, are those agreed by and with our trade unions who work in partnership with us to ensure that that environment doesn't happen. And in relation to whistleblowing, and I have responsibility for the whistleblowing policy in the Trust, we do have whistleblowers dealing with all sorts of things, and their rights and their confidentiality is protected. And I take your point so well that if you don't address, and it can only be one individual, the impact can be catastrophic. So why would you tolerate it? Why would you tolerate it? And we set out to do all we can to both prevent it and to deal with it when it arises. Let me be very clear about that.
Okay, Deputy Chair.
Thanks, Chair. Morning.
Good morning.
I just wanted to ask you about the comparability of information and statistics between DHSSPS, the trusts and NICs. That different information is collected and different forms of information by those three organisations. What attempts have been made to align the information so that there's direct read across?
I certainly don't know of any attempts that there's been, because I think the comparator, as maybe I mentioned at the outset, probably was more appropriate to other health and social care settings. So there hasn't been. But you're right, it creates a difficulty, because if we try to compare ourselves with any sector, whether it's civil service, education, etc., it's hard to tell quite how well you're doing.
Yeah, I mean, you're absolutely right. Having the data and the information that allows us to do comparisons is what informs future policy and interventions. I think what's very clear for us in the department is that the monitoring over the last number of years has all been manual, and you'll know the issues and the problems that that brings with manual recording. And in addition to the point Marie raised about the short-term absences where the cause is unknown, there's a huge amount of data in there that we can't get at and examine. The advantage and the investment in the new HR system will bring with it that commonality to provide not only the data on the days absent, but as I said before, using that industry standard of identification of what is the reason for the absence. We'll then be able to use that data, not just the reasons for the absence and the number of days, but to be able to segment it by working groups, which is something that we haven't had access to. So that appropriate comparisons can be drawn either at consultant grade, at nursing grade, or at admin grade. So there will be grades where it will be appropriate to make comparisons with the Northern Ireland Civil Service, and there'll be other areas where we wouldn't want to make that comparison because of the nature and intensity of the work, the rostering hours and all of those influencing factors. But we could find appropriate, not just comparators, but benchmarking, and be able to take single packages of best practice and apply them to particular grades, particular types of illness. So I think the opportunities that lie ahead from having that rich source of data and information will enable us to make improvements going forward, and will be able to give us information that we haven't previously had access to, and will inform and change thinking on how we deal with these issues.
I just noticed in the report here on page 30, it says DHSSPS does not hold information beyond the summary level identified in a 6-monthly report. It is therefore unaware of the underlying issues. For example, the extent of long-term sickness absence, the main causes of sickness absence, or any relationships that may exist between sickness absence levels and age, gender and grade. So is that what you're talking about
that's
addressing?
That's exactly the point, and you've added other segmentation to the data by age, gender, grade, all of those things. We don't have access to that. And I think the key issue is that by collecting data manually, well, it's prone to human error. It's out of date by the time you get it. And the fact that we're doing the analysis and it all is manual, it's 6 monthly, it's retrospective. It's not providing managers with data and information that allows them to manage and to take action and interventions that can enable improvement. So everything is in an historic sense. We're so moving to a real-time system that we can, if you like, get real-time reports and focus in on particular areas is going to make the difference.
You said that a lot of the information was collected, recorded manually.
Yes.
Are you now moving to an electronic system which improves the collection, recording and comparability of information?
Yes, that's the new HR pay and personnel and subsistence travel system that's being introduced and rolled out across all of the trusts, and that data will be recorded by managers and by staff electronically, and the department will have access to that database of information, and our statisticians will be able to draw down the data and then to slice and dice that in terms of being able to provide management information reports, and not just the department but the trusts and the line managers managers in the trusts will have real-time information on their staff, on the trends, on the historical position, and be able to act accordingly at all levels, at management level, frontline management level, at senior management level in the trusts, and then at a regional level at the department.
I think just so that we're not sitting in the trust, counting up. There is the old system was an electronic system, but there was a manual transfer of information through salaries and wages. Who input it, and it was a bit archaic. Nevertheless, even within its limitations, within the trust. Managers are informed on a regular basis of their performance as part of their accountability review process. The department just can't access that in the way that's needed to understand across the whole of Northern Ireland, and that's what Patricia's emphasising. But I wouldn't want to go away today thinking that we do not on a monthly basis sit and examine, because our figures go to our board every month in relation to sickness, and that's the same with other trusts. The old system is not sophisticated, but it still provides some information. The new system, once it's embedded, we think will be super. It's
and
that level.
Proactive management.
Yes, and right across the whole region and with the department. So that will be really good.
Okay, and are you happy that the new system will identify the gaps in information identified in the Audit Office report?
Absolutely. The beauty of it was that it was a system that we were able to design. It was a particular system, but we had, for example, one of my assistant directors who spent 2 days a week for months, along with others, sitting down, going through every element of the system and making it our own. What is it we want? What do we need? What are the issues and challenges? How can we make this system work for us? And that time and that detail has meant that we have a really super system. So we're really looking forward to being able to use it to its full extent.
Well, that sounds good. But the question I would have to ask you after that, it's good to have all this information, to have the comparability and so on, but will it lead to any real results in reducing sickness absence levels?
But we believe it will. One, because it's real-time information, so the managers in health would, for example, in some occasions, look after hundreds of staff, and they wouldn't be within their sight line. They'd only have to go onto their dashboard to see lots of information about appraisal and all sorts of things, but absence as well, who's in, who's not in, all of that. So they will have real-time information. Then, as part of the fact that they've real-time information and that conditions are recorded, they will be able to help inform our strategy in relation to what areas of health and well-being we concentrate on. Are there other things we need to do by way of prevention? And then we, centrally, corporately, as part of the accountability review process, will be able to hold managers to account in terms of complying with the absence protocol. Given that we've all of the information relating to the absence, the reasons and so forth, what have you done to deal with that? Yeah. So that should all result.
Can you give us a sort of an illustrative example of information you will receive through the new system and how you would act upon that information and what possible improved outcome it could bring?
Yes, certainly. So people are forced to go in and say what's wrong with someone. So someone has recently gone into hospital to have surgery. We can see that that surgery is associated with a bone, a musculoskeletal, an operation on their shoulder, for example. That means we know that there's an issue there, and that if we were able to accelerate their physio service, they could get back to work more quickly. Therefore, we've that immediate information. We can refer that to our internal physio service that's available for staff in order to help them to return to work more quickly. And that's actually happening as we speak.
That's good. Illustration of an individual case. I was thinking more of the broader bands of sickness that might be revealed through the information.
Well, even under the old system, we were able to identify that the groups of staff who had the most sickness were some of our ancillary and general staff, our support, domestic, portering, cleaning, catering and so on. They would traditionally have the higher levels, although I would have to say that those levels, certainly since my time before the trusts, have almost halved, and they're really, really good. So we would know that there's a high level of sickness there. What are we going to do? We've got attendance managers and experts who do case management work with the individual managers. Therefore, we would send them in and say, your sickness levels are becoming problematic. Give me your top 3 or your top whatever number of people who have poor attendance. We'll case manage this through with you. Real-time information at the point. We can see it centrally, the managers can see it, and we can go in there. And we don't go in there in a punitive way. I don't want you to think we go in there in a heavy-handed way, because people are sick, and they're genuinely sick. But if we see a rhythm and pattern of absence that looks problematic, we can send people in quickly to work with the manager and try and deal with it.
What was the figure you gave for the total cost of staff illness and health service?
We haven't given a
We
figure.
haven't given a figure because we don't.
Is there a figure?
No, there's not a figure because, as I understand, there was a figure, and I looked at that in the report. I'm not sure how that was made up, because there's the cost of absence, whereby there's the cost and the loss of productivity of people not being there, but there's an additional cost if you have to backfill, for example, a nurse post.
Yeah.
And you don't backfill if somebody's off in an office, you won't backfill, but you will not leave a shift unsafe, so you will backfill. So there's the cost that's lost in productivity, and then there's a cost associated with additional staff, but that is not being, as I understand, costed across health.
No, we haven't got that.
Because of the lack of sophisticated
I
detail.
think that it would be.
Yes.
Because I would like to know what the total cost is and to what extent the interventions are cost effective.
Absolutely. Well, I understand that this is one of the points of having the new system, that it will give that level of detail, including, if someone is off sick, if there's a consequential backfill, which increases the cost.
Yeah, my understanding is with the new system we'll be able to extract data and turn that into costing data of the cost of the actual absence. We'll then need to marry that with the other costs from the trusts in terms of backfill of nursing, locum posts, whatever that might be.
And when would that information be available after the new system is up and running?
Well, the new system, the last trust just went on last month, I think.
Last month was Western.
Within a year, say?
Oh, yes.
Within a year.
Yes.
I think you'll need a full year of data for that to be meaningful. To start to do it in quarters or in months, it won't be meaningful. We'll need to get through a full cycle, and that will give us a baseline as well of data to move forward with.
Okay. That's grand. Thank you very much. Thanks, Chair.
Thanks, Deputy Chair. I just want to come back to Paul's point about the whistleblowing. I would be most familiar with the Northern Trust, and I think that in terms of whistleblowing and whistleblowers, the treatment of them by the structures and the management has been absolutely appalling. And it is something that is going to impact, and is impacting hugely on people's health and well-being. And I suppose, especially within the hospital setting, when it's a life and death situation. I know of a number of cases where nurses are afraid to speak out. There's nurses who have been familiar with cases where somebody has lost their life, and they have the moral dilemma: do they speak out and have themselves treated as other whistleblowers have done, which is in a negative way, and do the right thing, or do they stay quiet and ensure that they have a content working environment to work in? Because the whistleblowers I have dealt with have been through hell as a result of the mistreatment, and some people within managerial positions have clearly frowned upon them whistleblowing. So it's a big problem, and it ties into what the Minister said yesterday in the review that was announced about this culture of not speaking out. And I can't speak at length to other trusts, but I know the Northern Trust is somewhere we need to put a particular focus. So I'm just wondering, in terms of the particular occupational categories, have you any mechanism in place to identify particular issues? If there's an issue, and there is issues around Causeway Hospital that we've found in terms of certain examples where the maternity service hasn't been up to a high enough standard, is that impacting in terms of sickness absence among the staff? Because obviously there will be an impact in terms of those stories going out in the media on morale, and also if it's not been dealt with satisfactorily internally, that will have a greater impact.
Well, I don't have intimate knowledge of every whistleblowing case right across Northern Ireland, but what I am very clear on is that our Minister has made it very clear, rightly so, that whistleblowers should feel free to say if there is an issue or a problem. I mean, there's nothing new about whistleblowing policies and encouraging. And of course, within any trust, you would want people to raise that. But if people don't feel safe in raising it, which in my view would be outrageous in terms of if they felt threatened in any way, but if they don't, then they can go through the system of whistleblowing, which I deal with in the trust. But yes, if staff feel there is that sort of, if you like, environment that they work in, that's bound to have an impact on their health. There is no question about that. But I work with the other HR directors right across Northern Ireland, and there is no trust that I know of that would institutionalise that sort of approach. If it happens, that is entirely regrettable, but goes against the policies and what's required in those trusts. And if people have to go outside of the trust, that is an instance of failure for the trust, that people feel that they can't go directly internally. I accept that. But no trust would want anyone to feel bullied or intimidated or unable to speak out. But I agree, of course it would add to sickness and feelings of pressure, and should not be tolerated.
I mean, you've highlighted the fact you deal with the whistleblowing cases in the Belfast Trust. I mean, what's your own analysis of, I mean, you will be aware of cases then, so what's the health impacts in terms of people that went through that process? And is there a need to review that process at the moment?
I think you always should review any process. Certainly the whistleblowers, I have a very good individual who deals with them directly, who's a nursing background and deals with them in a very compassionate way. And I've had no complaints about how they've been treated. I should also say, leaving aside whistleblowing per se as a policy and so on, remember in health, we have very, very skilled, very effective, very able trade unions who tell us very clearly if they think there is a problem within the organisation of a collective nature or indeed an individual nature. So we don't just rely on people going through managerial lines, or in the extreme, if you like, having to go through a whistleblowing way. We relate very closely with our trade union reps who represent individuals and groups and listen to them if there's any problems in, and we talked about departments earlier on. So you've got the protection of the individual who can raise it at any time managerially, and if they don't feel they can raise it through their trade unions. They can raise things through HR, which is usually seen as a safe, almost neutral or pastoral sort of approach to these things, and through the formal whistleblowing policy. So there are mechanisms that, and you will always hear about the bad things, but I would hope the evidence demonstrates, so it's not just my feeling, through staff surveys and checks with investors and peoples and other accredited bodies, there's certainly not a culture of that within health. But if cases go wrong one individual, that's still not good enough. I accept.
Well, I would argue in terms of Northern Trust, there's certainly a culture there. Going from the number of cases that I processed, and even the Public Accounts Committee have looked at similar cases too.
And the Minister
there is an
has.
issue.
I'll give you one.
Okay.
Everyone, I'm happy to name
And
it.
I certainly accept what you say, but I do know the management, and there is a management team up there who would obviously want to deal with that, and I hope you're finding that is the case.
No, or not.
And there is
Could
a
I just
review
come in
that
there for a
has
minute?
been kicked off, so I think
Just, maybe wandering a bit outside the remit. I've had, and I'm sure other MLAs here in the same position, with quite a few complaints against the Health Trust from patients, and I do get the very strong impression that the whole procedure is actually weighted against the complainant, and that there is very little objectivity in dealing with complaints, and where there are independent people brought in to adjudicate on them, they are usually former employees of the health department or one of the trusts, so that there's an innate bias, even though the people are described as being external and independent. They have been part of the system in the past, and therefore there is, as I call it, an innate bias there. And I think that probably, there may be a need for a totally independent commissioner for dealing with health complaints, especially some of the more serious ones.
And Chair, I think we need to be careful that we're not preempting the review that the Minister has kicked off, and we haven't come today with any evidence or figures to be able to respond to your concerns in that area, and hopefully those will be picked up as part of that wider review. But if there's anything in particular you need us to come back to you on, we're happy to do so.
But I think
Quite a few.
I mean, another anecdote. We were dealing with the case in the Northern Trust, and I've highlighted it with the Minister in terms of the young couple from Ballycastle, and they lost their child primarily because of the lack of access to an operating theatre in 2008 in Causeway. Now, there was an internal report done that found that the hospital was at fault in 2009. And they didn't get access to that report until they brought the trust to court in 2013. So they had to wait 5 years, or whatever it is. But it wasn't the staff fault. It was because the facilities weren't in place, the structures weren't in place. It was a managerial issue, as far as I'm concerned. But the staff would have been aware of what the reason was for that death in 2008, and they couldn't have said anything, and didn't say anything from 2008 all the way to 2013. So the stress on those individual members of staff must have been immense, but there was a feeling of the management and the structures in place that meant that they were put under that stress, as well as the patients.
And this, as you say, is, well, no doubt will be part of that
review and that inquiry. Hopefully all of those issues, including the impact on the staff, the stress levels, the sickness absence, the handling of complaints, the protocols, the processes, will all be part of that. And we shouldn't really cut across that at this point.
Okay, Mitchell.
This kind of issue, of course, we've all been kind of wrestling with it for some considerable time of sickness absence. In December 2012, according to the audit report, the department informed all of the arm's length bodies, including the trusts, that they would be required to take steps to minimise sickness absence during 2013-14. Is that a calendar year or
1st of April?
1st of April, so
Yeah.
financial year?
Financial year.
Okay, and and does that include the ambulance service?
Yes.
Does it include all agencies and status of management as well as medical?
Yes.
It's all
staff
certainly all of the
employees.
trusts, and I'm representing the trusts, but it's all the employers,
Yes.
All the employees?
employers,
employees.
the agencies and so on.
Yes.
Okay, yeah. And you were to undertake a review and report by September of last year. Was that review completed?
The review of the sickness absence levels. Well, I think the reason that the full review hasn't been able to be carried out is that we don't have the data because of the transfer from one system to another system, and I think that was also recognised within the report that we'd be moving to that.
Well, who set September 2013?
I'm not sure who set September.
But you didn't have the ability to deliver it?
Well, each
Figures were
trust,
given
each of the
2013.
was when we got the figures, and each trust does report back, and we do hold, the department holds accountability meetings with each of the trusts twice yearly, and there are interim reports on that basis.
No, but it says undertake a review and report
That was the last recommendation.
to the body board and the department by September 2013. So who would have set that target when the capacity wasn't there?
That was the target set by the audit report.
No. According to this.
Which one?
Sorry.
Which recommendation?
You're
Well, if we read
Third recommendation?
2.32,
Yes.
the department informed each of its arm's length bodies And there's 3 bullet points there. The last one is undertaking a review.
And report to the... yes, well, I think yes, there have been reports, but we haven't had a formal review, and that would happen at the end of year. It does say September 2013, but we haven't completed that.
And for the evidence of this session, the reason that you haven't completed it is that you do not have the capacity, and presumably you didn't have it when the report was, when the target was set.
No, I think the issue, as I understand it, and I'll check to ensure that this is absolutely correct, is that we've got 2 systems running. We've got the system that, as you described it, the old system, the HRMS system.
I mean, I'm assuming that there was something in place, something that needed to be improved, augmented, or whatever, to give us an improved performance. And in December 2012, all the department wrote to all of its various agencies and structures. It also set a target for producing a review. I mean, there's a straightforward answer to this, I assume, which is that you never at any time had the capacity, and it still isn't there.
At this point in time, I think that's correct, yes.
Okay. How do we define long-term and short-term?
20 or more days is long term, and below that is short term.
Right, and the review presumably would have developed some kind of report and summary of the patterns and themes that emerged. Absolutely critical if we're going to respond and do something about the other targets.
Yes. Can I say just again, in case we think this is still, even during the period as we implement, we do know the short and long-term absence. We do know the reasons. So there's continuous review and analysis of statistics. For example, with short-term, it would be in around 1.5 in comparison with long-term, which would be 4.5. You know, that's the variation. So short-term is a lot less than the long-term.
When you say 1.5, what is that percentage?
Apologies.
No, it's just for the record.
Sorry, I'm sorry about that. Yes, you know, if the average is around 5.5, it's really less than 2% is short-term. And I think that I'm actually glad you raised that point, because it is important. I've worked in the service a long time. Years ago, the short-term absence would have been the longer, and so therefore the casual absence would have been the problem. The casual absence, I think, in health, you know, has been well reduced. You know, the Monday-Friday-itis, you know, then people take off and question mark and all of that. It's now the longer-term absence, which relates then to surgery, illness, musculoskeletal, mental illness, all of that, as opposed to the more casual absence that would have been a feature, I'd say, 15 years ago, 20 years ago.
Yeah, but for some time, and I mean, this committee and the PAC that I was on previously have inquired into this issue. They have, I think, satisfied themselves that our issue is long-term absence.
Yes.
And clearly a detailed analysis of that might establish whether there's any abuse in the system, or whether the responses of the individual departments within the public sector is adequate to addressing that in any meaningful way. As, you know, setting realistic targets and then having the means and the wherewithal to do something about those targets. Are we now, given that it is, we've completed our year and we're into, right?
14,
we're
15,
now into
yes,
the next year.
yes.
So how quickly will that year's data be processed, and when will the review be completed so that we can see the themes and the...
Yeah. One of the things I should say, and just to be completely clear, is that as part of the governance arrangements with each of the arm's length bodies, which are clearly referred to in here, including the trusts, is that there are end-year accountability meetings held with the department, and that's the opportunity, and those are held usually in May, June time, to allow the data to be gathered. That's an opportunity for each of those arm's length bodies and the trusts to feedback specifically in terms of the review and to give evidence on those underlying issues. So We will have that by June of this year in respect of each of the bodies. What we haven't done at this stage and could seek to do is to wrap that together into a more comprehensive report, giving the figures for last year.
But as we move, through the first year and complete that, we then have a data set
We do.
that will be augmented by further reports and inputs. Just redefine again, or remind me again of the definition for long term.
20 days or more.
20 days or more.
20 days or more. And are we expected to accept that it would be the wash up at the end of year that would actually start to address those issues?
Not at
Are we?
all.
Well,
No,
that's
no.
what I'm getting at. I mean, at what point after the 20 days will this get flagged up as something that maybe we should take a look at before it becomes 30 days and 40 days?
No, I mean, absolutely. And this goes to the policies that all of the trusts have, which defines absence as 20 days. That doesn't mean to say they don't act until 20 days. That's the definition in terms of the stats. If, for example, you were off, and it's to do with mental health or some reason that we think that we can help or intervene on, you'll be referred to occupational health pretty much straight away. Okay? If you are off on surgery and we know you're coming back in 6 weeks, you'll still be off 20 days, but if you've got a line that says you're coming back, we're not going to refer you. So there are triggers, including looking at 20 days and other things, but that doesn't stop any action in an individual case. 20 days is there for recording purposes, but the action that you take as a manager will depend on the illness of the individual. We don't like to push people into occupational health automatically because they've been off. People are ill, we know they're coming back, they're maybe getting treatment for cancer. You know, there's no automatic, we're going to send you to Occupational Health. It'll be taken, each case is taken on its merits. But for recording purposes and the definition of long and short, it's 20 days. Action can and does be taken before that, depending on the individual circumstance.
Well, I mean, given that we're trying to improve the process as we go through it, and I do accept that, because I think that in the lifetime up to now of the Assembly, whatever length of time it has left, we I think can record an improvement and an increased focus, which has produced some outcomes. You're indicating that we will have the ability to identify and disaggregate the causes, able to establish whatever patterns and themes is probably not the right word, but I can't think of the right word.
That's right.
To allow us to, address these kind of issues. For instance, we had a correspondence from the Chartered Society of Physiotherapists. They talked about a pilot scheme. You've made a number of references in the course of this session to access to physiotherapy. They have given us some indication, evidence to be tested, but it's quite impressive of the, you make an intervention, give people quicker, more rapid access to physiotherapy, will at least deal with the MSK dimension. But they say it was a pilot scheme that was discontinued. So which is it?
It's not a pilot scheme that was discontinued, actually, because it came from our trust. We have 2 physiotherapists who are dedicated to occupational health, 2 staff.
Sorry, are you talking about now one trust?
Yes, I'm talking about one, and there are others. But I was
what is there
this-
across
I will-
all the
I
trusts?
don't have the
Anything?
numbers right
Don't
across the
have
trust. I was exemplifying, I think, 2 things. One, to assure you it's not stopped. What we did in order, because there was pressure on patients and them being seen, we took our physiotherapists out and targeted them towards our patients there for a few months, but they will come back. And not only do we think it's a good scheme, and can I tell you that we reckon for every £1 invested, we probably save £3+ on sickness levels. We wish to extend the scheme, and we'll be writing to the department, who've been very good about supporting it, and the other trusts will be saying the same thing to you. If there's any way we can ring fence money, this is self-financing. So please, no fears, and the Chartered Society of Physiotherapy, I'm happy to give them that positive message back. We will not be stopping this scheme. We're making it available widely.
Well, I mean, they give us a very blunt, and I mean, this is an absolutely up to the minute. We got this last week. The scheme was discontinued. So was the scheme in one trust area only? One that you would be prepared to testify is
Ours is
value for
not
money?
discontinued. It's not discontinued.
And is it going to be introduced right across the service?
I think that depends on the financing, the debate with the department and other people.
No, but you're not
But
saying it saves you money. And
It does save, and I would commend
isn't
it.
it?
I would commit, because it was pilot. It's now been evaluated. It's part of the discussions. Patricia
Yes.
holds monthly meetings. It'll be on the agenda for the HR forum to discuss with other trusts to commend it as evidence-based improvement. So we're at one on this.
So, I mean, they're telling us that this is quite startling, right? Of those that work, 80% indicated the physiotherapy had prevented them from going absence
Yes.
at all. And of those already off sick, 80% indicated the physiotherapy had shortened their absence. Respondents indicated that the service shortened their absence by an average of 6 weeks.
Can I
That's
tell
incredible.
you? Yes, I've had these same people, i.e. these physios along with our occupational health, presenting to the directors in our trust to say, look at how well this worked. So we are absolutely at one. And if I know the Charge Society, happy to direct them to me, and I'll be giving them an equally positive
Well,
message.
we'll be happy to do that too.
Okay.
And we'd share
I
that.
mean, I have to say, just in general, I am, I'm reassured that now, I could examine why it took the 2012 to generate this directive, but what's the point? I think what we should do is just encourage the Minister, the Department and yourselves to continue. I do think that earlier interventions might actually get to the heart of this issue of how the long-term absence stats is pulling the overall stats up, because as you have already indicated, and I think it's well recorded, the short-term statistics have actually shown a significant improvement over recent years. So let's.
Really is common sense, isn't it?
Okay, that seems to be, yes, but maybe, okay, well, I nearly followed through on that. Okay, a bit of common sense would be a good idea.
Time's got the better of us, unfortunately. We have a couple of other questions in terms of benchmarking, but we'll send those to you in writing for a response. That's okay?
Surely,
Yeah,
absolutely.
Okay, thank you very much.
Thanks
Thank
very
you.
much.
Sorry, I need to take up a lot of room.
Okay, members, moving on to the next briefing. Can I refer you to the following documents, the 8P briefing paper, pages 96 to 100 of your packs, and also with your table papers, there's a House of Commons Library briefing note on air passenger duty, which is provided for some up-to-date background. Okay, can I welcome to the meeting Tony Simpson, Strategic Policy Division, Central Finance Group within the Department, David Thompson, Deputy Secretary, and I haven't another,
John Sims.
Ron Sims in the Department as well. So you're all very welcome. If it's okay, we'll just go straight on to questions, if that's okay, in terms of the study. Now, we obviously had the last update on this, I think, was in September of last year, and at that stage, members were told that the second stage report and the final stage of the report will be completed and presented to both ministers by the end of the year. Now, according to this, the report will be completed, or the draft report actually, will be completed by May of this year. So I'm just wondering, is there any particular reason for that delay, and how can the committee be assured that the issue is receiving enough priority from both departments, given the lag?
Chairman, well, thank you for the opportunity to be here. I think we told the committee at the last session that because there have been quite a number of studies already well carried out and researched, we would do a literature review first. We assessed that literature review and decided that then we needed to get further expertise in to help us look at some of the Northern Ireland aspects. So we then went to the market through CPD to get aviation consultants. They've been appointed and we're doing some modelling work with them. We were also aware that there were developments in Europe. State aid is very tight on what you can give to airlines and airports, but there have been some movements from Europe as to what you can and cannot do. We wanted to wait for that to come out so we could take that into account in assessing what more we can do here. And we got hints that there might be something also coming from Department of Transport on route development funds, and sure enough the Chancellor made an announcement in the budget on that. So we knew there were a number of issues bubbling around, and we wanted to pull all of those together. We are still aiming for a report by the end of May.
Okay, in terms of the specialist aviation consultants, who are they exactly? And where are they sourced from?
York Aviation, I think, is a title. And we did that through a procurement competition with CPD.
And then in terms, I mean, you referred in your introduction there to the Chancellor's announcement. I mean, obviously there is an intention to provide start-up support for Liverpool, Leeds, I think Inverness as well. Is there any indication that local airports here will be able to avail of that support package? Is there any more detail?
Chairman, I brought John Sims with me today because John's our guru on this, so without embarrassing him, I'll ask John to give it a little bit more detail.
They didn't even give you a wee label.
I know. I prefer it that way, thank you. Yes, as David said, until March of this year, we were under previous state aid guidelines. So effectively, you could do our development funds, but it wasn't worth doing them because it was purely marketing assistance. So that effectively, for the last number of years, no region has done an area development fund. The Chancellor announced in the budget that he was going to do, well, there's a regional air connectivity fund in existence, but that's for public service obligation routes. The new state aid guidelines means that he has expanded that to take into account the new guidelines, which offer much more flexibility. I suppose you've asked a couple of questions. Will it apply to Northern Ireland? Yes, it will. We've been in touch with the Department for Transport, and we're going to keep in close touch with them. We've also been in touch with the Scots and the Welsh, because they have a similar interest in us. There's a £20 million fund a year. We're not sure, is that going to be partly passed out to the regions? Will airports apply directly? DFT are working with Treasury and the Commission at the minute just to work through the guidelines.
So when you're saying 20 million, that's 20 million across the board, or
across the UK?
Okay.
So that's and it's over. I think it's a 4 or 5 year period. There's a couple of positives in the Chancellor's announcement. Well, first of all, he has committed to supporting regional connectivity, which is good for us. And in expanding this fund, it's where we sort of wanted to be before. Also, there's the potential for Northern Ireland to do its own air route connectivity fund, and we've put down the marker with Department for Transport that we want to explore how we do that. We need to do this through them and then through the Commission. So there's real potential here to do things that we couldn't do before. The devil's going to be in the detail, and the way the state aid guidelines are worded at the minute, airports of up to 3 million passengers can avail of an area development fund. Airports of 3 to 5 million passengers, it's in exceptional circumstances. Now, in Northern Ireland, City of Derry Airport has 370,000, so it's in that category. Belfast City Airport has 2.5 million, again it's in that category. Belfast International is 4 million, so it's in that exceptional circumstance case. So we're in touch with the Department for Transport. We've put down the marker that we're going to be making the case that we're exceptional. You have to fly from here to get the GB before you get anywhere else. We've put down that message with them. They're in discussion with the Commission just to see what exceptional circumstances means, what exactly can be assisted, what can't be assisted. So we're in that mix at the minute. But certainly from a Northern Ireland point of view, we can avail of UK fund, and we're exploring the potential for.
And when can we expect to know the outcome of that?
They've said it could be the summer. They're going to engage with airports, engage with all the key stakeholders. They're engaging with the Commission at the minute. So we're keeping in touch with them. We would hope to see something in the next few weeks, certainly some initial guidance, because it takes time to notify a scheme. So if, for example, ministers decided we wanted to do a Northern Ireland one, we need to get in there quite quickly. So the sooner DFT can clarify just what the guidance means. Whenever the Chancellor mentioned Liverpool as part of this fund, it falls in the same category as Belfast International. It's got about 4 million passengers. So they'll be waiting to see just how they can avail of it.
Paul? Just on that point, and I don't see how Liverpool equates to exactly the same as ourselves, because it's within a region that's probably easier connection to other airports that would maybe offer more opportunity within a close proximity. The state aid issue is something which I can't get my head around, because we seem to always be looking for permission to do things, where others seem to be, whenever they do it, they look for forgiveness for what they have done. And I'm thinking in particular of what has happened in Dublin in relation to their introduction of new routes and the accommodations that have been made to allow those routes to come, and how have they been able to either sidestep the rule or bend the rules to ensure that they were able to attract new routes and new airlines.
I suppose your first point about Liverpool, to clarify, I would agree with you that we're in a different position from Liverpool. Liverpool's just down the road from Manchester. You know, it's not that far from what would be the high-speed rail network. I suppose my point was, from an airport size perspective, it's caught by the new guidelines, so they'll be waiting to see. So I suppose from our point of view, National Liverpool, the same airport size, what we will be looking to make will be not just on a case-by-case basis, an exceptional case for routes. We want to say that Northern Ireland is exceptional in this case.
Yeah.
As part of what we've been doing, we have been looking at everywhere else to see, and we've been asking airlines and others, who does things that we could be doing differently? Are others out there doing route development funds and then seeking forgiveness afterwards? It's not happening. Basically the guidelines shut down that sort of open route development for the last number of years. So if somebody's doing something, we're not aware of it. But from the Dublin point of view, Dublin, there's a difference between the Irish government and Dublin Airport doing something. Dublin Airport is publicly owned, but it's commercially run. For example, so as long as it operates within those parameters, it can do route incentive funds in the same way as our airports could. For example, Edinburgh Airport, it put together a £15 million route incentive fund. And so long as it does that from its own operating costs and its own profits and doesn't seek government assistance, that's where Dublin is investing in route success.
Chairman, if I just, that was one of the reasons why we decided we needed specialist expertise, and without York have done a lot of work across Europe, and clearly they have commercial confidentialities, but they can tell us what's happening in various places. Now York, we've asked them that question about Dublin in particular, and York have confirmed back to us that Dublin Airport operates profitably. All of its borrowings are on a commercial basis, so there is no hidden state aid in the Dublin operation.
Our own report will be back May of this year. Is that on target? Yeah.
I hope so, although as John, well, we should be able to produce a report, although as John has been flagging up, because of those various developments that we were aware of coming, on the one hand, we don't want to produce a report and take advice to ministers if we know something's going to change in 2 months' time. On the other hand, we don't want to continually delay because, otherwise we'll never finish the report. So we are aiming for a report to ministers in May, but it may have some caveats to say we need to look at what's going to happen from the Department of Transport or whatever.
Was there not some mention within the budget in relation to APT as well, that there would be a look at how APT is dealt with? Because I appreciate that the Republic of Ireland made a decision to actually abolish APD, as did the majority of Europe. And unfortunately, we decided that we would keep this. green tax, and I'll just use that term because that's what it's supposed to be.
What a green tax, as you know.
Never was.
But I think
I think I'm using that with.
I think, Chairman, that even the Treasury has admitted that whereas this might have started off as being with some concept of green tax, it is a revenue-raising tax now.
Absolutely.
What the Chancellor did in the budget was, there were 4 bands before. Band A, which is 0 to 2,000 miles, and then Band C, B, C and D, which is your long haul. From Northern Ireland point of view, this long haul's devolved and it's been eliminated. The Chancellor has collapsed B, C and D, and there was issues with the way it worked. If you flew from London, it's capital cities, if you flew from London to Washington, you were charged the Band B rate. If you flew from London to Hawaii, you were charged the same rate because it's based in the capital city. So what he's done is he's collapsed B, C and D into the lower rate, which doesn't impact on us because we already have it devolved and eliminated. He hasn't. He froze Band A, and one of the things that the industry are looking at very keenly is, well, obviously there's a lobby out there from airlines and others to say this should be got rid of, but he has frozen it, and I think that's the 2nd year in a row that it's been frozen. So it's still the £13. So now effectively there's 2 bands. There's short haul and long haul.
Just on the point about APD, I mean, obviously, Permanent Defence and personnel have given costings on implementing a 0 rate for the north for short haul flights. If we were to have that power devolved, is it then the case that the power itself is devolved and there's no change to the policy in terms of the rate as it is at the moment, that there's no substantive cost in just having it devolved?
If we were to seek a devolution of short haul APD, we would need to take a block adjustment broadly equivalent to the amount of the tax that's raised now. So if we were to take those powers and not change the rate, we would take a block adjustment of somewhere in the region of 60 million, and then we'd need to raise that through through kind of recovering the tax, and then there would be whatever administration costs there would be from running the tax. The administration costs in terms of the Band B rate are quite low because we're not actually collecting any tax, and it's limited to a very small, small number of airlines. So the administration costs would be more significant, and then we would be building in a bigger volatility, which isn't a cost per se, but there's a management issue in terms of the volatility of the block.
Is there any estimates around the administration costs?
No, we haven't entered into those discussions with Treasury.
But might that be included in this report?
No, it's not. It's not an element. This is essentially the kind of terms of reference. The objectives of this report are to look at the factors that influence both passenger and route making decisions, and then looking at what we could do potentially to improve our connectivity. So it's not taking that next step to see what the implementation issues would be, should we direct us in any way towards APD. But
surely if you're going to devolve APD to improve air connectivity, then the administration costs, all the costs, should be taken into account in a study such as this?
Well, it's really to see whether you're right, Chairman. If we're going to pursue that, it's certainly something we would need to investigate. But at this stage, the question for us is APD in itself even a tool, an economic lever which could influence connectivity? And there's a number of factors. There's a broad range of factors which we've already seen through the literature review. So it's trying to unpick those, and part of the work that the study's doing, and we have the Northern Centre for Economic Policy working alongside the aviation consultants, trying to do some economic modelling to see what the sensitivities of price are generally. So that's I suppose the first stage for us to see whether this influences connectivity in any way. But yes, if we were to take this to the next stage, then there would be more. We would need to take a more traditional kind of business case type approach to see, right, well, what are the total costs for that potential benefit if there was one in that regard.
Mitchell?
Yeah, I mean, generally speaking, I just welcome this. It's a sensible approach. And there appears to be a degree of momentum in it, and certainly I like the direction of travel. We are actually talking about modelling out, elastically, it says here, which is interesting, the impact of price changes, including variations in APD. And then we use that information or at least projections on any changes in passenger numbers to assess the economic impact. And really, at the end of the day, has to be the core of it. You know, can we achieve our intention, our priority intention to grow the economy, and this is certainly one of the elements that we're going to have to address in some way. So I think gathering information of the degree of urgency that seems to be reflected, David, in your remarks, gives me some encouragement. We've been kind of picking at this for a long time, and I think that at least now we're going to be operating, hopefully when this report emerges, with some kind of evidence base to kind of argue the case. Your point about the costs, you know, I think transferring the powers means that until we decide to do something different, we're going to effectively just be the tax collector and have to kind of pass, you know, make up any adjustment in the block as a consequence. But there is no real kind of cost to us until we start to kind of apply these evolved powers, we get them.
Well, there would be, like HMRC have even told us, if we go back to the devolution of the long haul rates, and we've negligible administration costs because we're not collecting any tax. But even at that time, HMRC told us if the Assembly took the decision that it wanted to introduce a positive rate, we couldn't do that immediately. There would be a lead-in time because they would need to amend their systems, and that we would need to bear any IT costs and implementation costs in that regard. And if we were to go the next stage, if we go to Band A, you know, you're moving from dealing with one scheduled airline and perhaps a number of charters over the summer to, you know, the vast majority of all flights operating from Northern Ireland. So while I don't have any figures or estimates on the implementation costs, you know, there would be a significant exercise in HMRC to recalibrate their systems, and they would ask us to bear the costs of that.
Yeah, well, I mean, it's nearly a theoretical argument, you know, because if they're not involved in the collection, then there's also savings involved, you know, because they have to deploy people to gather them up and to account for them, whatever, you know. So it's a trade-off, but we're not there yet or anywhere near it. The literature review was obviously very informative in this kind of further phase of it. Will that be appendix to the report? Because we'd be very anxious to see that report when it becomes available.
Yes.
It will be available. Whether we put it as an appendix, nobody's given much thought to, but it will be available, yeah.
Well, I mean, I hope we're giving thought to it. There's a date here.
No thought as to whether we will publish that as an appendix.
I see. Okay, but if it wasn't, could it still be accessed?
Yeah,
if the committee was interested in seeing that? Yeah. Okay. Thanks very much. I actually find this positive, and I just want to kind of be recorded as welcoming this work. Thank you.
Tony, you had said there about the IT costs and the fact that across the water they would have to recalibrate their systems and so on. Why is there a significant cost, or I presume significant cost? Is it, you can have this debate about welfare reform, whatever, as well. But surely, in terms of IT systems, you should only be able to adjust it on a computer by clicking a few buttons to recalibrate a system, as opposed to significant costs.
A one-off.
It's not something that's been explained. Yeah, well, in a general sense, but do you have any sense of where that argument comes from?
I'm not. Unfortunately, I'm not in a position to comment on what precisely they would need to do. We're not kind of privy to the systems that they use to kind of operate the tax. But it's short of saying that they have said that we would need to bear whatever costs they would need to incur.
They wouldn't rip us off, sure.
I just get the sense sometimes they throw this out there as a bit of a red herring without any substance to it. So it's something worth considering in the longer term.
Yeah, no, certainly. If it was something to be pursued, we would need, as we have done in other areas, we need to engage with Treasury to fully explore that. But it's been recognised. I think that's down the line.
Okay, Adrian.
I just think the cost is an important part of it, and it would be helpful if we could get some costs now at this stage as well as part of the whole report. Because you can't make a decision on cost of here, just on the hearsay. We need to know exactly what it's going to cost. And I know it makes us saying it's cost nothing to devolve it, but you're saying it does. So even them costs now would be helpful as well.
The only, I suppose, the only note of caution with exercise is David's point earlier about, we want to get, there's some important analysis which we're undertaking to date, and we want to get that. We want to publish that and start considering that and have the debate on that. From my experience of dealing with Treasury in the past, I think to get them to scope out, it mightn't be possible to do that very quickly, and that might be something that, if we need to return to, perhaps the best approach might be to get the study out as quickly rather than
But if the study is not going to include the cost aspect, then this is something we could look at.
It's certainly something we can.
Could you take that away and then perhaps right back to the committee?
Yeah.
I mean, there's no reason why you can't do a ton track approach, go ahead with the report and also start
No.
Okay, members. Okay, gentlemen. Thank you very much.
Thank you.
Well, you stay where you're at now. Okay, members. Moving on to the next item. Legislative consent motion on changes in APD bans and UK Finance Bill 2014, referring to documents. Letter of intent from the Minister of Finance, pages 101 to 102. And kind of welcome Tony back to the committee for this as well. Just in terms of background, Tony, could you give us a rationale behind the decision to abolish bands C and D?
Yeah, well, the kind of explanatory notes along with the finance bill, the Treasury have indicated that their rationale here is to improve connectivity to emerging markets such as Brazil, Brazil and India and China. So, effectively what they're doing by abolishing the band C and D, they're bringing them down to the band B rate. So it's reducing the APD that's payable on those routes. So that's the government's stated kind of rationale behind taking this move.
Something that we've discussed here before in regard to APD is the issue of private jets. So if we were to agree the LCM, would that potentially restrict any future scope for the executive to increase APD for some long-haul flights, including private jets or flights over certain distances? Not
in terms of private jets. I think there's a couple of issues. In terms of private jets, no. When the powers were devolved on long-haul flights, we also have the power to set a separate rate for these kind of private luxury jets. The default position was that the private jet rate would be set at twice the standard rate. In the new arrangements the Treasury put in place, they're changing that to 6 times. But that's a default position, so the executive or the Assembly already has the powers to set a separate rate for private jets. So, agreeing to this wouldn't tie our hands in that regard. Where there is a slight limiting of what we can do at the moment, the Assembly could set separate rates for bands B, C, and D. We don't have any flights to destinations in C and D, but now we will only have one band, which is band B. So we will have the power to set one long-haul rate. Okay. Is there any other policy implications then that we would need to consider, or is that just it? Not really. The two, in terms of the financial implications, there are none, because we've already reduced the rate and we've taken the block grant adjustment. So no, there are no real implications or impact on Northern Ireland of this change. It's essentially a legal, a technical legal issue where downstream what we will need to reflect the changes in the banding structure in the setting of the Rate Act, and as a way of paving the way for that is taking the legislative consent motion to the Assembly to give the Assembly its place to allow Westminster to legislate by changing the bands. So there are no other kind of particular issues. Okay, any other members?
Just, Chair, you mentioned private luxury jets. What's in between a luxury jet and a business jet, for example?
They're effectively one in the same. Let me see. The higher rate applies to a flight aboard an aircraft of 20 tonnes or above with fewer than 19 seats. So it's effectively a sizable jet with a small number of seats.
That's just a luxury bit. Intrigued me.
It tends to be just the description that's used. Strictly speaking, it's in relation to the seats and the size of the aircraft. But we kind of refer to them as luxuries. I've never been on one, but I'm guessing it is.
The misnomer, is it? Because you could have a standard utility, if you like, 19-seater,
As far as I think, yes. Well, I have no sense really of what that, what 20 tonnes is. But the description is always of them in that category, so that's probably quite a sizable aircraft.
I still don't get the luxury bit in it at all.
I'm probably not best placed to comment on how luxurious they are, but it's just that it's a description that tends to be used to describe them. You know, they are private jets that are quite
sizable. Do you agree that
sizable.
you could have a bog standard jet?
You could have perhaps a bog standard jet in terms of specification, but probably to fly 19 passengers, probably still quite expensive to run. So I think that's
not to do with luxury, though, is it?
No.
It's to do with the engines.
Yes, it's just the description. It's the description is used.
Okay, thank you.
Tony, there was an argument around the time of the devolution of the long-haul flights about the potential cost. I think it was 3 to 5 million at the time. Even though the New York route was going to go to the wall anyway, there was a cost to the executive. So does this here affect the cost to the executive?
No, there's no the block adjustment mechanism is set at that time, and this is no implications for that whatsoever.
No implications. Should it have any implications? Or no. Okay, members.
Yep.
All right, Tony, thank you very much.
Go on your luxury jet now.
Fly out of here.
Aye.
Okay. Moving on to the DFP briefing on the review of fiscal powers. Refer members to DFP briefing paper at pages 104 to 108 of your packs. Can I welcome to the meeting Colin Sullivan, Director of Strategic Policy and Reform Directorate, and Paul Montgomery, Strategic Policy Division at CFG. Do you want to make some brief opening comments just before we go to questions?
Yes, thank you, Chairman. This briefing session relates to the Economic Pact commitment to examine the potential to devolve specific additional taxation powers to Northern Ireland Executive. I highlight at the outset that the main focus for our Minister and the Executive remains on taking the responsibility for the rate of corporation tax. And the Government has committed to making a decision by the autumn in relation to corporation tax, and it's within the same timeline that we're considering whether other taxation powers should be devolved to the Executive, and we're preparing the work on that. In recent years, significant work has been undertaken on the devolution of tax powers through the Holtham and Silk Commissions in Wales and the Calmont Commission in Scotland. And in addition to that, there was the Murley's Review, which looked at the UK tax system as a whole. And these commissions have come to broadly similar conclusions, namely that landfill tax and stamp duty land tax should be fully devolved, whilst there should be partial devolution of income tax. There's also been general agreement on the reasons why it would not be appropriate to devolve other main taxes in terms of legislative constraints and the potential to distort the economic activity across the UK. In light of the significant amount of work that's already been undertaken by the other and for the other devolved administrations, the intention is that the analysis that we will be undertaking will draw heavily on those reports, and that will form a significant part of the evidence base when considering the devolution of taxes to Northern Ireland. At the same time, we'll obviously wish to take account of our distinct local characteristics. As set out in the briefing note that we provided to the committee, taxes and duties are an accepted matter, with the Government having responsibility for fiscal policy across the UK. However, the Executive has been able to introduce the carrier bag levy and has taken responsibility for APD for long-haul flights. The alternative approach has been to seek derogation from national taxation policy where there is expected to be a negative or disproportionate or unintended impact on Northern Ireland. And this reflects the point made in the Calmont Commission that a distinction needs to be drawn between dissatisfaction with the policy and the argument that it should be devolved or reserved. In terms of the next steps in the process, the Minister has set out 2 key conditions, and he mentioned these in the motion at the beginning of March, whether the devolution of tax should be sought. In the first instance, devolution of a tax should be affordable in terms of the impact of any likely changes on the funding available for public services. And this is in the context, as he has outlined previously, that the economy, whilst improving, that's not reflected to the same extent in public expenditure, and that across the UK there remains constraints on public spending is forecast to fall by over 15% in real terms over the next 4 years. And the second condition the Minister attaches to whether or not to devolve a tax or duty is to look at the clear economic or social benefit, and that is shown to be the case. Our Minister's indicated there's no value in taking responsibility for a tax just for the sake of it, particularly given the administrative costs involved. And one example of administrative costs is that the initial cost of updating the HMRC's IT systems to support the devolution of income tax to Wales has been estimated to be in the region of £45 million. And we're not clear what the figure would be for Northern Ireland, but it could be similar. Over the coming months, each of the main UK taxes and duties will be examined on the basis of the factors set out in the briefing note. The analysis will largely involve a review by DFP officials of the large amount of published material I've already made reference to, although we will also seek input from other departments, taxation experts and key stakeholders where appropriate. And on the basis of the findings for each tax, the Minister will then make recommendations to the Executive and the Government in the autumn for the most appropriate taxes to devolve.
Okay, thank you, Colin. Colin, in terms of the Minister's conditions that have been attached to this review, I mean, affordability is the first one, and ensuring the change does not impose a disproportionate burden on the fund available for public services. And I suppose it's interesting corporation tax isn't included in this. But, you know, in any argument about taxation, you can have the power devolved, there'll be a price tag attached to it. But if you change your economic policy or change your tax rates, then you can actually generate more revenues to come in. So are you looking at that particular aspect of it in a holistic way? Because if you say you had air passenger duty, you have it devolved, but the economic benefits of that could far outweigh the cost in terms of the initial cut to the block grant, for example.
Yeah, we need to look at what the economic benefits might be if you did devolve the tax.
So that would be included within the affordability aspect of it?
Well, the affordability is also about the administrative cost as well. And the wider economic impact needs to be taken into account as well in terms of affordability, the overall impact on the block.
In terms of the scale of this, I mean, there's obviously a reference to the Welsh and Scottish Commissions, Calman, Holton and Silk. Is this going to be very much a small scale example of those?
We think there's and Paul is the expert, he's been through all these reports in detail, so I'll turn to him in a moment, but there's a huge amount of work already done in this, and they're looking at the same taxes in largely similar circumstances. So we think if we're going to meet the autumn timescale, we will need to do it in a more focused fashion, but draw upon the material that's in those reports.
What we found, looking through Holtham, Silk and Calman, was that there was a large degree of consistency. The same issues kept on coming up for each tax through each of the commissions, so therefore it's highly unlikely that if we looked at it separately that we'll come up with anything other than the same conclusions in broad areas. There are aspects where Northern Ireland will be different, and we'll look at those in sort of greater focus.
And I mean, seeing in terms of those examples, and we referred to it in the previous session, administration costs, IT costs, what kind of findings have you come across in regard to those areas for your income tax, VAT, your headline taxes?
Well, that's what we're going to be looking at, but in terms of the admin costs for the income tax, there are estimates out there for Scotland, and they were applied in the draft Wales bill, which was published last month. The admin costs for income tax are being updated for Scotland in April, or this month. So we'll look at those again. It was telling that the Holtham or the Silk Commission have all come up with the same finding, that the admin costs are not expected to be materially different for Wales and Scotland. So therefore, extrapolating, you would think that we aren't going to get that much of a reduction if we were to devolve income taxes for Northern Ireland. In terms of the likes of VAT, I think Alan Trench, who I think you've held a seminar here, he's referred to some interesting points in terms of VAT and sort of excise duties for example, for alcohol, where you would normally think, oh, well, this is something that you could do relatively easily, but he's referring to that the excise duty is applied at the point of importation or production, which would make it much more difficult to then assign those duties to Northern Ireland. So I think that, well, I don't think, examining what you discussed in the previous session, I don't think we'll be coming up with precise figures. All we'll be able to say is, well, they're likely, the administration costs are likely to be high or low, and then when you're looking at the sort of the amount of revenue involved in the duty and the likely divergence from the UK, we'll be able to sort of make an assessment there as to whether sort of the costs, the potential costs are worth the potential benefits.
And in terms of air passenger duty, is that coming under this remit at all, or is it separate?
Well, because there's ongoing work on air passenger duty, we're not going to be looking at it at this stage. We may look at it later on in the process.
Okay. Judith?
Thank you, Chair. Given the sort of 70% fall in the stamp duty intake at the moment, would now be a good time to devolve that power?
It depends.
Sorry, I was going to say stamp duty obviously is a very small proportion of the overall tax take for Northern Ireland. I think it counts for 0.4% in 12-13. So there is an issue about volatility, and clearly the housing market can determine the intake take for stamp duty. But it's a relatively small measure, so it probably wouldn't have a huge impact in overall terms.
In terms, the experience from corporation tax is that Treasury will not simply look at it and go, well, oh, it was collected 50 million last year, that's what the block grant adjustment will be. Treasury will look at it over the medium term and try and make an assessment so that it's not, they will look at the cycle, and they'll probably, my presumption would be they would say it's at the bottom of the cycle if the block grant adjustment's unlikely to be 50 million, unfortunately.
Is there any consideration being given to the operation of the Barnett formula here as well, including whether we might be better served by a needs-based mechanism for funding, given the potential for convergence in the future?
No, this study doesn't get into the Barnett formula. It just simply looks at the particular taxes and duties and the merits of each one, and then we'll come forward with proposals for Minister. The Barnett formula is obviously a much bigger issue.
If you want to diffuse that particular problem, you cut whatever wires you want.
Okay, any other?
Can I just ask, you mentioned the aggregates levy there, sitting for 4 years now. What, is anything happening?
I think that's your next session.
The next session is going to cover the aggregates levy.
Yeah, but you've mentioned yours here. You know, the fact that it's been...
It's one of the ones that...
Sitting there suspended in 2010, pending an EU state aid investigation, which is ongoing.
That was a derogation whilst our review is looking at the devolution of taxes.
I'm just making the point about aggregates. That's one of the things that might be of interest to us.
Well, it's better that we have a derogation than devolution in terms of that, because if we have a derogation from a UK national policy, it means we don't pay the cost of Northern Ireland having a lower rate or having a relief introduced, whilst if we were to devolve that, we'd pay the full cost. And I think
I'm just
that's
wondering how long we're going to wait. I mean, it's absolutely incredible that it was 4 years and not make a simple decision.
The difficulty of EU legislation, I'm afraid.
Exactly. Thanks.
You're saying there that the recommendations will be put to the executive by autumn. Now we've looked at other reviews that have overshot their deadlines. When in autumn are we aiming for?
We're working basically to the same timescale as the decision to be made on corporation tax. And the government's likely to make a decision on corporation tax post the referendum in Scotland. But no later than the Chancellor's statement, which is in the last few years has been in early December.
Early December.
And the important thing to say is this year.
2014.
Okay, Mitchell?
Yeah, that's just, I think generally speaking, again, just to kind of welcome the work and the exploration in this area. An issue that has that has kind of bothered me for some time is the difficulty in getting precise information in relation to any of the various forms of taxation and duties. And corporation tax, expecting the decision in the autumn. We are now starting to kind of design a range of possible options in the context of that decision. Are we any clear as to the quantum in terms of corporation tax, in particular this vexed issue of companies operating here, profiting in this economy, but registered at head office level and paying their tax, their corporation tax in London?
Well, the Treasury are working through possible scenarios for Northern Ireland devolved corporation tax, but it will come down ultimately to whether or not there's a decision to devolve.
Yeah, but are we, in terms of, say, we are pressing for the devolution, so we're pressing for the optimum outcome. Do we know exactly what we're pressing for? Or are we hostage to whatever HMRC are prepared to? I mean, are they preparing, for instance, for 100% disclosure, such as they would demand of the rest of us?
I think the thing to say is we haven't seen a lot of the detail yet on what is actually proposed. We've had some conversations with them, but until we see the detail, we'll not be able to advise ministers.
Yeah, okay, but the whole theory of this, in terms of, say, fiscal powers, say, measured against the #1 kind of priority in the programme for government of growing the economy and rebalancing the local economy, depends on us having fairly precise calculations based on the fullest disclosure. And I mean, I just set this all together apart from the ping pong that the parties, depending on their constitutional perspective, will have about the size of the deficit or not. But I mean, any realistic projections would have to be based on realistic figure work. So as we explore these other areas of taxation and the possibilities and the potentials and the costs, because there will be an impact in each case on the block, then we do need to know exactly what the corporation tax take is, so that we can measure at what point this becomes a viable decision.
And the costs that need to be taken into consideration will need, in terms of administration, so we'll need to include the compliance costs to ensure that there is a regime where there isn't tax avoidance.
Absolutely. I mean, that's just a given for me. If we're taking the powers, then we're also taking responsibility to run the scheme properly and to avoid any of the well-known kind of problems that those who have that responsibility up to now have to cope with. That's just part of the grown-up kind of approach to it. But we do need to be satisfied that we know precisely the quantum involved, even to measure our ability or our efficiency in terms of the current arrangement. Certainly you don't want to get any worse. We might even improve.
To say we'll need to see more of the detail, I think, to be able
No,
to
that's
advise
my point. Yeah, I'm agreeing with you. But I mean, are we doing that? Are we pursuing that information? I mean, do we know at this point in time, in terms of all of those companies and corporations that are operating, and this isn't the biggest economy in the world, just where they pay their corporation tax when we're addressing this question?
Well, we will know one of the benefits of the approach we're taking is that, unlike UK's relationship with the likes of Holland or the Republic of Ireland, the HMRC will know the amount of tax paid in Northern Ireland and in GB, so that the bill that we're going to be faced with in terms of profit shifting and group relief costs and sort of tax avoidance, we would hope would be much lower, because one of the problems for HMRC with other countries is transparency. And that's been a big issue that's been raised by the OECD, is that tax authorities simply don't know the amount of tax that is paid in different jurisdictions. In respect of the devolution of corporation tax to the Northern Ireland Executive, they will know, so therefore we would hope their tax avoidance measures would be much more effective. In terms of the overall cost, there is a degree of uncertainty. We simply won't know how companies will act in response to a reduced rate of corporation tax, and they have significant scope, changing their capital allowances, changing their treatment of group relief to fundamentally change their corporation tax liabilities. So to an extent, we won't know until the system is up and running. At the same time, however, if it turns out that there are groups of companies that are involving in sort of extreme tax avoidance events, we can change the policy and the legislation at a later stage, and that's what we sort of stress with HMRC, is that if something happens and there's a significant cost down the road, we would like to have the scope to be able to change the regime to minimise the cost to the Northern Ireland.
And I mean, I'm very confident that we could actually administer such, such responsibilities. We are looking towards a decision. We are hoping and expecting that it will be a positive decision. We're looking at the implications of such a positive decision, which might well be, for instance, that there is an adjustment on the corporation tax to harmonise with our nearest competitors. And those corporations, whether they're incorporated in London or whether they're registered in terms of their tax liabilities in the north, will also be looking at those factors. So they probably know more than we know in respect of where, in fact, they make their tax settlements. Do they do it through a head office in London, even though they're paying tax on profits generated here? Do we not, need to know that in terms of how we measure our ability to grow the economy and whether we're making progress in that direction or not?
Well, as Paul says, I think that if it turns out that the regime that's put in place for Northern Ireland is such that there is significant tax shifting or tax avoidance, that we'll need to change the policy to avoid that.
Yeah, and that's happening now. I mean, they're taking those measures, and presumably those that are interested in tax avoidance are also doing whatever they do now, and people are taking steps to minimise that. So with us, as with any kind of tax raising authority, what I'm getting at is, like, why do we not know precisely what the tax take is? Whether that's made up of tax paid through London kind of head office, registered offices, or whether that's tax paid through operations here in the north. We should know entirely what corporation tax is paid in terms of profits that were generated here in the north.
The difficulty is attributing the economic activity to between Great Britain and Northern Ireland in terms of, for example...
With respect, you see, a company would know. They wouldn't be here. They know if they're making profits here. And in fact, the indications are, from what information can be screwed out of them, that they're making more money here. On a per capita basis, they're making more profit than they are in other regions in England. But they know exactly in terms of their... They choose as either administrative convenience or otherwise, I don't know, they pay their tax through a registered office in London. But we need to have that information. They know exactly how their different installations right across this region are performing and what profits are being generated.
If they know themselves, and to be frank, I would doubt it, because you can never know precisely, because if somebody, if your laptop, the price you pay and the profit from that is made up of a whole range of different things. It is the scientist who designed it, it is the people who built it, it is the people who market it, it is the people who sold it to you, and they all each have their bits of profit. So deciding which base of that, which amount of that, and this all takes place in different parts across the world, and deciding which part of that is specifically to an individual location is going to be extremely difficult. In terms of HMRC looking at the corporation tax take attributable to Northern Ireland, for a company that has activities throughout the UK, they've basically used employment and said that the employment in Northern Ireland as a proxy for the share profit. And we looking at it, we can't think of anything better. In terms of looking at individual companies, there are privacy and disclosure, and we have pushed for as much data as we possibly can from HMRC in terms of the detail of the corporation tax that is attributable to Northern Ireland, and they're very, very reluctant to give us anything. And please be sure we have pushed for as much detail as we can, because it's important to us in terms of advising ministers and policy to know the precise implications of what will happen if we reduce our rate.
Well, you see, to get back to the point, you know, we're looking to this scenario, looking forward to this kind of being a positive decision. These companies operating in this jurisdiction where that power might be transferred are obviously also looking to that situation, because they're going to have a tax liability.
Yeah. I'm sure they'll have accountants that will advise them, but they'll advise them on the scheme that pertains whenever it's been agreed. As yet, there is no scheme agreed, so it will obviously depend on what the parameters of the scheme is.
Yeah, but I mean, I'm pointing to, you know, I'm pointing to a convergence of interests. We need to know. They need to know. We are hoping to continue to have a profitable coexistence going forward, and perhaps even have an economy that's growing, which will be good for them as well. So, you know, it's only a matter of months away. I mean, surely we should be engaged in discussion about scenarios and economic modelling and so on and so forth.
Well,
because it's absolutely germane to what we were talking about in terms of the other taxes.
We've had a number of, over recent years, we've had a number of forecasts and estimates of the impact of a 12.5% corporation tax rate. You know, it started off at sort of 150,000, then down to sort of 58,000. It is all over the place.
That's what bothers me, you see, because every time I ask a question, I get an answer that seems to be either divided by 2 since the last time, or multiplied by 2.
Looking at the economic literature, and we've all, we've gone through it in depth with Treasury, with their experts, and even if you look at the Office for Budget Responsibility, who are the experts in this, and they're much better than we could ever find from consultancy or sourcing ourselves. Their forecast of UK corporation tax receipts can be way out, and they're be 20% out from year to year. We simply don't know, because of the nature of the corporation tax system, where companies with the same starting position in terms of gross operating profit can take into account of reliefs and allowances, so that the bottom line when it comes out is radically different. And it is going to be a highly uncertain policy initiative. I think ministers accept that, and we're trying to get as much precision as we possibly can in terms of both the costs and the benefits. But I'm afraid there are limits to the analysis we can undertake.
Okay, that's really as far as I can take that particular discussion. Just one question in relation to the work that's been done in Scotland and Wales, which, I mean, I support the approach. There's general kind of commonalities there which would argue against reinventing the wheel. But are there any particular peculiarities or distortions that we have to take account of in terms of ourselves vis-a-vis both Scotland and Wales?
I think in terms of Wales, on the income tax issue, a big issue for them was the migration of people from England, and they were looking that if they they increased the top rate of corporation tax from 40% to 41%, that they wouldn't get any more money, because everybody would because even a small amount of people moving could radically reduce their revenues. We're unlikely to have that. In terms of VAT and excise duties, the issue would be smuggling, and whether or not if we had reduced or increased the excise duties, whether that would
reduce the scope for smuggling. Would reduce those costs?
I wouldn't say that. It depends on the extent and whether or not the illegality would continue. But it's just an example of where something would be different.
Yeah, but you would think that harmonisation would eliminate any incentive for smuggling or whatever.
I would, smuggling could still continue on.
Instead of habit. Okay.
That's right.
I know. Guilty, Your Honour, but my father did it before me. Thank you.
One other question then. I mean, obviously the Scottish independence referendum is in September, before unions are due to report back on this. If Scotland decides to vote yes, obviously how would that affect HMRC, Treasury? They will obviously have to try and review all their operations and change. I mean, it's something you need to take into consideration, I suppose, given that it might happen. But would that possibly mean that our interests are sidelined whilst they deal with those particular issues, or could that be an opportunity for us to review our relationship in terms of taxation?
I think nobody knows what will happen if Scotland were to vote yes. I think it'll have a huge impact, and it'll probably put government into a spin for quite a while. And I would have guessed that would have an impact on what we're doing, yes.
Mm. And is there any indications from Treasury or Whitehall that if there's a no vote in terms of Scotland, that the whole issue of, there's been much discussion about the more federal setup post the referendum. So is there any indications from Whitehall at the moment in terms of...
We've had no indications from Treasury that they're looking at other options. But they may well be doing.
Don't say much, do they? Okay, members? Okay, gentlemen. Thank you very much.
Thank you.
Sucker for punishment, Okay, members can refer to documents at pages 110 to 115 of your packs. Do you want to just give us a wee update in terms of where we're at in regard to the review of the aggregates levy?
Yeah, I certainly can. Sure. Well, the committee were provided with a written update, and I know, Lizzie, you've commented on this already, and I'm pleased to say that further to that update, I'm in a position to report some positive progress more recently. I'm not sure if members might find it helpful just to give a bit of a recap on the aggregates levy. As members might be aware, it's a levy on the commercial exploitation of aggregates, and it's charged at a rate of £2 per tonne. And after the gradual introduction of the levy across the UK in 2002, the aggregates levy credit scheme, or the ALCS as we tend to call it, was approved in 2004 to help to try and address the negative impact that the tax was having locally. And under that scheme, operators who agreed to undertake some environmental improvements of the quarries were able to avail of an 80% reduction on the levy, so at the current rate from £2 down to 40 pence. And looking back to September 2010, the European Court annulled the state aid decision which approved that scheme. And following that, in 2011, the UK government announced its intention to open a formal investigation of the compatibility of the ALCS with their state aid rules. So since then, ourselves, working in conjunction with Treasury and importantly the industry and their representative body, Kupani, who were in the Assembly yesterday, have been working to gather the information that the Commission need to inform their decision, and from our perspective, enable them to come to a positive decision on the allowability of the aid. And in this regard, there's essentially two decisions that we require from the Commission. To be approvable, it needs to be consistent with the environmental aid guidelines. And the initial set of guidelines in this regard were published in 2001, and these were then superseded in 2008. So we need a decision basically in two periods, prior to 2008 and post 2008. In terms of 2001, the broad issue is that the aid has to be compatible with the operation of the common market. So the aid shouldn't distort trade between member states. The 2008 guidelines introduced a more stringent requirement that the aid should be what is termed necessary, and by that we mean it shouldn't the tax should be, operators should be able to pass the tax on without the full amount of the tax without it distorting output. So the aid is, and if that's not the case, then the aid is necessary, because without that aid or the reduction, it's going to impact on the output of the industry. So in terms of the former, compatibility with the operation of the common market and not distorting trade between member states, The ALCS was only available to operators in Northern Ireland. So the court decision found that that was distorting trade, because if you weren't in Northern Ireland, you couldn't avail of the support. So in response to this, we've been working with Treasury and DOE to put in place a retrospective scheme that would allow anyone that used aggregates and imported stone from another member state, the Republic, for example, to reclaim the amount of the levy that they paid, so to kind of level the playing field in that regard. We've put that to the Commission, and they've responded to us, and the engagements we've had with the Commission have been particularly encouraging, and they've asked us for a number of points of clarification in terms of how such a retrospective scheme could operate. And on the 1st of April, Treasury, after discussing with ourselves and DOE, we feel we've addressed those concerns. We've put a paper back to the Commission. So we're hopeful that that retrospective scheme would enable the ALCS to be cleared from between 2004 and 2008. We obviously await the Commission's decision on that, but we're quite optimistic that that's going to address that part of the time period. So it's certainly, and Leslie referred to it earlier, this has been going on for a significant period of time. So to get that informal signal is certainly very, very welcome and very positive. I've mentioned the 2008 guidelines for the period after that, and I said we've been working with the industry to provide the information. And essentially, one of the key pieces of work we did in 2012 was we surveyed industry members, and to kind of get a sense of their level of output and turnover and the prices that they were charging, and trying to get some sense of what impact the full introduction of the levy was going to have. And we put some evidence back to the Commission in 2012. The challenge we had there is it was very difficult to unpick the impact of the downturn and the recession, which was driving down construction output anyway. So it was difficult for us to separately identify in that what was the impact of the ALCS being suspended and what was just a general downturn. So the Treasury or the Commission have written out to us again in January, and the details of that are in the paper, asking for some further clarification. And I think it's fair to say there's a recognition the Commission have written out this. There's a recognition in the Commission, I think, that it is difficult to unpick this. We can't get global data which is going to prove this. But we're working with Cupani again and 5 of their largest operators to get very detailed, granular information which is showing the sensitivity of their output to changes in price. And it's effectively showing, that when the prices are lowest, then they have the biggest market share, and when prices are going up, that's really impacting on the output from their particular quarries. So it helps us prove that necessity point, we feel. So at the moment we're pulling that information together, and we hope to present another paper to the Commission in the very near future. So I think after quite a bit of time, I think there's some very positive progress on this, and the informal signals that we're getting from the Commission are that they're hoping to move to a decision, or we're hopeful that they will move to a decision by the summer. So that's essentially where we are. But from our perspective, it's very positive after a period where we haven't got much steer from the Commission on where they were with all this.
Definitely sounds very encouraging. But in the event the European Commission doesn't find in favour, what's Plan B in terms of the department, and how would they support the industry in the event of a negative decision?
Well, we feel, and the UK government feel, that we've got a very strong position. In terms of the rules that govern these sorts of aid. If they find against the aid, the next stage for the Commission is to recover that from the beneficiaries of the aid, which were the quarry operators. Now that would be devastating for our local industry. In terms of a Plan B, we're not there. The Commission would take that action, as they would be obliged to do. But we feel that where we are now is that we're in a very strong position, that we are very hopeful that isn't going to be an outcome that we're going to have to deal with.
Any other members? Is it?
Yeah, Chair, Decision of the court still a problem?
Well, that's what started the whole process. So that was the catalyst for this. So until the commission, that judgment is there, and that's why we've had to suspend the ALS, because we needed to respect the European Court's judgment. But the commission have done what they need to do. They've instigated a formal investigation. We're doing what we can do because we're informing that. And if the commission then, on the basis of this additional information that we provide, then find in favour, well, they've responded to the court's decision by investigating and finding that there may or may not be state aid issues. And as I've said, we're kind of very confident now that they will find in our favour. We have a very strong argument.
Okay, Tony, accept that, but is it not a case that the court may say, look, I'm sorry, we're unconvinced here? The decision stands?
No, it's the commission are now in the decision-making body. The court found against the process that the commission had gone through to arrive at their judgment. They found that the commission hadn't gone through the necessary steps and considered the necessary information in sufficient detail. So we've had the commission have responded now to that court judgment. So the fact that they're going through the investigation and doing the detailed analysis is addressing that court, the judgment's concern.
It's only the process really that's challenged.
Yes, so the court, there isn't a role now for the court to say, no, we don't like the outcome of your stated decision in terms of what we're doing. It's now on the commission to review that, and that's what they're doing, and we're working with them to do that.
Is there a risk of someone going back to the court and say, hey, this is state aid continuing?
You could, well, I'm not sure what the process is in terms of once something's been challenged, whether it can be challenged again. But I suppose the one comment I would make is that this has been slightly embarrassing for the commission. So in terms of the investigation that they're doing now, it's a thorough investigation, and which I'm sure they would argue is not going to leave them open to the same accusation again.
Okay, thanks, Tom.
Okay, members? Okay, Tony, thanks very much for that.
Tony, thanks.
Okay, members, moving on to subordinate legislation. Refer members' proposal for SL1, the Whole of Government Accounts Designation of Bodies Order NI 2014. Purpose of the draft order is to enable DFP to request information from those departments and bodies designated in the schedule to the order and to pass the information provided to Treasury for use in the preparation of the Whole of Government Accounts. It will be subject to negative resolution. Any issues? No. Put the question. The committee has considered DFP's proposal for subordinate legislation under the Whole of Government Accounts Designation of Bodies Order NI 2014 and has no objection to the policy applications of proposed legislation at this stage. Agreed?
Agreed.
Correspondence, yeah?
Yeah, I'll just draw a few items to members' attention, Chair. Page 122 of the pack. ETI committee writing regarding the use of renewable energy in public buildings and proposing a joint committee debate, plenary debate on the issue, because the responsibilities seem to cut across certainly DFP and OFM, DFM and potentially ETI. That committee has been writing to DFP, and DFP has advised that while it collects data on energy consumption in public buildings, it's only responsible for the office estate, which amounts to about 7% of the overall public sector estate. So it is a limited responsibility in terms of energy consumption. So it's really just to check. There's a proposal there that the chairs of each committee liaise on the issue, but maybe to inform members of this committee's contribution to any debate, it might be useful to get DFP to provide an oral briefing on its responsibilities in that regard, just in advance of any debates.
Okay, members agree to that?
Yep. Then there's various pieces of responses from other departments regarding sick absence, and those will all be collated and analysed, and committee kind of draft draft committee position or report on the issue. And one way of kind of reporting that might be, Chair, to cover it as a strategic finance issue, and then there'll be an upcoming report from the committee coordinated report on budget 2015-16. So that might be an opportunity to include it as a strategic finance issue. Just in terms of that, the last closing session is with DFP. And that's scheduled for the 30th of April. So if members are content just to share the other departmental responses with DFP just in advance of that session on the 30th.
Yeah, that's a good idea.
Then, in terms of the strategic review of rate collection, the department has come back to at the last session on that. The LPS officials agreed to provide the committee with two things: the recommendations from the Ernst & Young report, and also the project plan to implement those recommendations. Now, the Department has come back to say the project plan will be available and will be made available in due course, but it hasn't provided the report recommendations. Just wondered if members are content to wait the project plan, or do they want to request the report recommendations in the meantime, or are they just content enough to wait for everything's right?
Yes, I would ask them, yeah.
To
keep them interested, yeah.
Okay. And then finally, Chair, the Human Rights Commission published a report on public procurement and human rights, and the committee sent that to DFP for a response, and the department has responded. It's in tabled papers, page 36. But if the Human Rights Commission had requested to present on the issue to the committee, so if the committee wants to take up that offer, there is a slot on the 14th of May whenever other public procurement issues are being considered. And just if so, it might be useful to send the DFP response to the Commission in advance of that, Chair. That's all.
Who else is up on the 14th of May, Shane, do you know?
14th of May,
Yeah.
that's the Central Procurement Director. They're up that day on various public procurement issues.
I'm just thinking, I think Sammy Douglas had an event in the Stormont Hotel yesterday about public procurement. I think the trade unions had maybe an idea to invite some of those up to present. I didn't make it down to it now, but maybe dovetail that in too.
Yeah, on the 14th of May, Chair, we have a session on the flexible working inquiry, and then there's a session with the CPD on the public procurement inquiry recommendations and implementation of those, plus the other issues that the committee had been interested in terms of prompt payment and sub-economic tendering and so forth. So would this be a separate session with the unions, was it?
Yeah.
Yeah. Okay, we can work on terms of this.
Okay. Okay. Also, members, the page 151. There's a letter from the Civil Service Pensioners Alliance. Who are not happy, to say the least. And this is a letter to the Minister. I'm wondering if we could perhaps invite them to present to the committee alongside some departmental officials. If members are content with that.
Chair, the only thing I would say, I mean, I've no general problem with that. I think it might be useful to scope out the ground. Could we get a departmental reply first and then take it maybe the next bit, because I'm also slightly conscious. I mean, I've been involved, I know, sort of on previous occasions over those discussions on this issue, and I think there's a sort of strong feeling there's a particular moral case. However, there is no admission legally of certain things happening, and I think the concern is if a particular route was gone down, it might cost billions more than anything else. Now, I'm just a little bit conscious that it may be useful to get at least some reaction of the department first, because simply inviting them up may give them a false expectation that something's about to happen. I suspect that may be very remote from the pensioners' point of view. I guess a different situation, because it's from the broader situation of what the executive's ultimately going to do on the issue of civil servants who work for or were seconded to the NIO and that sort of things. I think there could well be something done that. I think that's doable in that regard. I suspect with the best will of the word, because in theory for a pensioner bit on it, the difference in terms of it actually potentially dates back 20 or 30 years. So in theory, if you actually do it purely on the basis of everyone in one sense who should be morally entitled to it, you're talking big enormous. Now, maybe it could be proved wrong, but I think it'd be useful initially if we got a response back.
Scope
first of all. And then I have no great problem with inviting people up after that, but just so we don't give people false hope in that regard.
Okay, members content?
Yes.
Well, I mean, yeah, I generally support that because I think, in fairness, the Minister seems to be reducing the quantum of dissatisfaction in that he's addressing those different constituencies that have emerged, and the secondment is a particular issue. I think we do need to consider what would be required to, or what would be desirable, is a better way of putting it, that would resolve that kind of sense of disillusionment, frustration and exclusion that's been expressed by the Pensioners Alliance. And I think that, you know, I don't think it's going to cost billions, you know. I think, but a common sense and compassionate discussion and negotiation could probably come up with an acceptable and affordable resolution. These people are actually absolutely convinced that they're just, people are sitting them out, waiting on them the day off. They do have, I think, a very legitimate case, and I'm not going to rehearse it all because members have generally speaking accepted that there was an argument there, and one that we inherited. But I think as the Minister reduces the overall problem by finding ways, and they are imaginative, creative discussions, and that's probably where the secret kind of comments are done, you know, because necessarily there's sensitivity here, and the court, I think, didn't leave much room to manoeuvre, but nevertheless we found it possible to manoeuvre. So we should bring the same kind of imagination to the outstanding issues as well, if we can. So I support what Peter has suggested in terms of how we sequence this.
Okay, members. Moving on to committee work programme, page 155 to 159. For members that the ETA committee will be meeting with reps from Ulster Bank and the Irish Bank Officials Association tomorrow at 10 a.m. in room 30. As per agreed protocol, members of the Finance Committee are invited to attend, and papers were emailed to members on Monday. Can I ask members to indicate if they intend to attend the meeting? So Secretary can make the necessary arrangements.
Yeah, I can't, because it clashes with the DOE committee at the same time.
I can't either.
Okay. Anybody going?
I've a nitty committee. We're all busy.
We've obviously supreme confidence in you, Chair.
You can handle it.
Okay. Okay, moving on to monitoring rounds. Can I inform members of the departments provide indicative timeline of monitoring rounds date for 2014-15? Can I seek agreement once finalised committee rights to all the statutory committees with the dates of monitoring rounds? Agreed. Head members to that one of the issues that has to be scheduled is committees coordinate the scrutiny of the draft budget. Seek agreement with the Commission research on the monitoring and forecasting performance of departments to inform this forthcoming scrutiny by committees. Agreed. Members content that the work programme is updated. Agreed. Any other business, remind members to switch on their tablets periodically over the Easter recess. This will enable any updates to take place and will help to prevent members experiencing any delays when using their tablet after recess. Can inform members normal practice for committees delegate authority to the Chair and Deputy Chair during periods of recess to submit views on the release and their withholding of information. And any non-routine contentious FOI requests received, committee will be advised of any such requests and the views expressed by the Chair and Deputy Chair and the response issued by the FOI unit the first available of the recess period. Members agreed to that. Any other business?
Can the Chair
next
agree
meeting
with all
will
of
be.
our-
Sorry?
Sorry, I thought you were asking, is there any other business?
Do you have any other business?
Yeah, can you deal with all those fracking emails for me?
No.
Yeah, absolutely.
I'll speak to Phil.
You know, there's a very handy button on the computer to deal with it.
Crazy. Next meeting, room 30, April 30th.